Yeah.
Yes, Bhuvnesh. Namaste and greetings. I am Omkar Shelar, researcher at IMPRI, Impact and Policy Research Institute, Prabhav Avniti Anusandhan Sansthan, Nai Delhi. Extend my homage welcome to you all to IMPRI by Policy Learning. Today marks day 10 of the Public Policy Qualitative Participatory Action Research Fieldwork Fellowship Cohort 6.0, an online national monsoon and autumn school program. A 5-month online immersive qualitative participatory action research fieldwork certificate training fellowship. This program is organized by Center for Human Dignity and Development. The chair of this program is Professor Vibhuti Patel ji, visiting distinguished professor at IMPRI. The convener of the program are Dr. Arjun Kumar ji, Dr. Simi Mehta ji. Before we begin, I would like to state the housekeeping rules. Please join the meeting on time. There will be the Q&A session after each presentation. Share your question on the question and answer box. The question must not be posted as an anonymous attendee. Ensure that your questions are precise. Refrain from making general comment in the question to save time. To begin today's session, I am honored to invite Professor Vibhuti Patel ji, chair of the program, to share her opening remarks. Over to you, ma'am.
Thank you, today's moderator, Mr. Omkar Shelar, for uh, welcoming the fellows for presentation of the research essays, and also Priyanka Negi, who has done a lot of work in coordination, and I think Reetlath also. But we all have had a very, very rewarding and enriching, intellectually enriching and electrifying sessions. And we also got so many new ideas and food for thought right from the time when keynote address was given by Professor Vijay Raghavan, who set the tone by providing the framework and the matrices of the whole course. Dr. Amarjit Sani's session on ethics also gave us a practical hands-on skill to conduct our research. And Dr. B. Rajeshwari, she also shared and gave so many useful tips for conducting the qualitative participatory action research. Dr. Prabhu Punna Swami's very important session on uh, technological advancement and artificial intelligence and skills, which is now a buzzword in the current context, was very uh, interesting, and also it very evocative. Dr. Soumyadeep Chattopadhyay's presentation on development of research and fieldwork questionnaire was extremely useful for conducting the research, and I think it happened when you all had started your fieldwork. And we also had a very interesting and very theoretically dense session later on. My session was on qualitative research and reporting, where I explained the principles, premises, and practices of various methods and ideological constructs of the qualitative research, whether it is constructivism, feminism, Marxism, discourse analysis, intersectional analysis, and also the research protocols of doing good, protecting the respondent, cultural studies, and also ethnic studies, the nuances of Dalit studies, disability studies, gender studies, women's studies, epidemiological studies, and cross-disciplinary and multidisciplinary and transdisciplinary studies were explained. Then we had a very theoretically robust and analytically grounded presentation by Professor Manjula Bharti on qualitative fieldwork research case studies. Dr. Bharti has given her nearly 4 decades of her life in doing very grounded research, which has brought in transformative changes in the areas, whether it is in Kerala, and currently she's working on climate change, impact of climate change on the western Maharashtra, especially Sindhudurg and Nashik. Dr. Purnima Chauhan's session on action research and how it impacts the policy, she shared a bureaucrat's perspective, and she, as an IS officer, how she applied this qualitative research methodology and brought in massive changes in Himachal Pradesh to address mind-boggling problems of housing rights of women, declining sex ratio, sanitation issues. And after that, we had Vikash Kumar's very interesting session on case studies in rural development field action research. Initially, he explained all the theoretical, it was very good summary that he gave on the 5 stages of qualitative research and gave the conceptual clarity. And he also gave 3 case studies of his personal involvement of participatory action research. It was in for the government of Punjab about the drug users and how their intervention came up with a policy to, instead of criminalizing and brutalizing the drug addicts, how to have a dialogical approach and bring changes. And he also shared his experiences of Bihar and how after doing focus group discussions and the pilot, they remodified their research tools as per the local needs. On day 9, we had Gumadi Sri Devi's presentation, very lucid, very captivating session on qualitative fieldwork research case studies. Dr. Gumadi gave so many examples of her research on food security, on urban canteens, on the displacement and relocation of the most vulnerable communities, tribal people, forest rights. And also she said that it's very important to have a permission of the respondent. You should see to it that the respondents are not harmed. We need to prepare the transcript, and if you interview them, you have to prepare transcript. The field notes are extremely important. So always go with the diary, field diary. Your observation notes are very important. Archival data, video diaries, visuals, photographs, all of them, they combine together, make a very effective and convincing research outcomes. And with this, I think now it's your turn, and we have to learn from your researches what kind of processes you have gone through. And I think we are going to have a very good outcome for the anthology. Thank you very much. Over to Omkar.
Thank you, ma'am, for walking us through the program progress so far. Now we will moving ahead with our creative project presentation. All fellows are requested to kindly accept the invitation to join as a panelist. This will enable access to your audio and video for the session. Yeah, I'll request Ashna Sharma ji to begin with the presentation.
Thank you, Omkar, for inviting me. I'll just share my screen. I'll try and share my screen. Is it visible, please?
Yeah. No. Oh, yes.
Yeah.
Working
Yes.
mode.
And I am audible clearly?
Yes, ma'am. Yes. Yes, ma'am. You are audible.
Yeah. So, I hope I am visible also. Am I visible or no?
Yes, ma'am. Yes.
Am I visible?
Yes, ma'am.
Yes, ma'am. Yes. Yes, ma'am. You are.
So, a very good morning to Dr. Vibhuti Patel and the 2 panelists who are there for this particular presentation, and all my fellow participants for this particular, culmination of this beautiful program. And I must start with the, acknowledgement of how enriched this was. It was so well designed, and the kind of resource persons that were pulled in for the program really made it very, very, as she said, intellectually enriched kind of a program. And this was the first kind of a qualitative program that I attended, and I am so happy that I did it. And thank you for the scholarship and everything that was extended for this. And a couple of disclaimers. One, that it is an ongoing research, it is not complete. And I've tried design thinking approach as the research methodology here. And that is actually a teamwork. And so my students have been pulled in for this particular project, and it is in the first phase, and I will try to present whatever we have done. And I've also given the timeline when we will be completing the project and how it would be. Yeah. So this is the title of my project, Multi-Stakeholder Perspectives on an Effective Take-Back System for Expired or Unused Medicine. design thinking approach. Okay, you can see the next slide. Is it visible?
Yes, ma'am.
Yes, ma'am.
So, if I ask a very pertinent question to all of us, I think there's nobody in this particular group today who has not experienced this, where we are like, uh, in the situation of disposing of expired medicines. Yeah, all of us have experienced this, but have you ever wondered what happens to these medicines? And if we check where these medicines go and what happens to that expired medicine box that is there in every household, most of us will have an answer that we dispose it off in the dustbin. Yeah. And we never care about what happens to it once it goes in the dustbin, whether it is disposed of properly by so-called municipal waste management systems or what happens to it. Yeah. So this is something that I am trying to work on. And the basic pertinent question is that, have we ever thought that it becomes counterproductive? There could be misuse of the medicine, there could be accidental ingestion. Somebody could inhale it, eat it, you never know what. There could be reactions and allergies. There is soil and water contaminations. They say these antibiotics have entered your food system so badly that even, the water we drink or, a lot of food that we eat is already contaminated. And we are not talking about things which are done deliberately, like, for example, oxytocin is actually injected in cows and, buffaloes so that they produce more milk because that's the hormone that they induce. That is deliberately done, but medicines, when they enter in our system, it is because we are not taking care of the system properly. So disposing of expired medicine safely is very crucial, and we need to do something about it. So can we limit the environmental impacts of unused or expired medicines? Is it possible, and how can we do it? This is the question, the main question with which I am working on in this particular project. So I'm sorry for a very verbose slide here, but I just didn't want to miss anything. So this is the my objectives with which we started working on it. First, understand whether people are aware uh, and what are the attitudes and pain points related to disposal of end users level. Like generally, you will find that there is a system that exists at the manufacturer, stockist, distributor, and pharmacist level, but it is not, nowhere connected to patient and consumer level. So what happens at the end user? So these are the two end users which we are going to focus in our research. We will gather insights into practices adopted by local pharmacies because they are the last in the value chain before the consumers, who need to be studied because they are supposed to be a very ambitious link for reverse logistics or for help in the disposal of expired medicines. Understand the regulatory provisions for manufacturers under the extended producer's responsibility, which is a mandatory policy, which is functional, which is like, something that a few select industries for which this has been made mandatory are trying to work on the system so that their EPR is in place. Then propose a system design that could help reduce expiry waste considerably. We don't claim that we will do it 100% because we know there are a lot of blockages. But then whatever level we can do it, at least propose a framework and a system design and ensure smooth take-back systems for the expired medicines. And the policy objective is ensuring effective collection and environmentally sound treatment of unavoidable waste through EPR, which is a very important policy objective. So these are the objectives in mind. The methodologies that are part of this project is first literature review to understand gaps in the existing status of this particular issue. Then understand stakeholders' perspective. Who are the multiple stakeholders? So we map the stakeholders and we zeroed on these three stakeholders. One is the end users, the consumers. The second is the pharmacists from where we buy and probably could be where we can also dispose of or submit it back. And the third is the waste management companies under the EPR. These are third-party vendors which are functional in other waste collection. So these are this, and there is a municipal waste team also. So these are the three stakeholders whom we would be studying and mapping. And then, of course, using design thinking as a research tool. So the design thinking process is like, in four phases. The first phase has two phases, empathize. And this is the phase in which we are in. We have already collected the phase one is over, and we have collected a lot of inputs, but we are yet to study and conduct the phase two of empathize. So empathize using lagging technique, where we actually go on probing questions based on the answers that we generally receive. So the questionnaire that we made is an open-ended questionnaire, and basically to get insights and not actually structure it, too tight, because we want to gather inputs from the stakeholders. Then also interact and observe and understand what are the pain points. And one of the major activities in empathize phase for design thinking is that we build personas of the, the segment that we are going to, study. So here personas are built based on, it's a fictitious persona that is built based on the representative of a bigger population. So that's how. So for example, in pharmacist as a category, there are pharmacists who are connected to manufacturers like Apollo or Dabur. They have their own outlets, and so they have a very defined system of take back. Then there are pharmacists who have multi-brand, things that they are selling. And the third is generic brands. So we have three personas for pharmacists that we need to build, because all three of them have different contexts and different systems and different pain points. Similarly, for customers or the patients, we are going to build personas which are the most representative. But we found that household would be a better thing instead of coming out with specific personas. Though there are categories like, households where there are only oldies above 75 of age, and for them it is very difficult to go back and connect with the pharmacist. So that could be one. And then there could be households where people are actually very nicely behaving in terms of other waste management, passing it on to the municipal waste system and other things. So these are the kind of personas that we would build based on the data that we have collected, and we generally would cluster, similar pain points, similar attitudes and things like that, to make them as a representative of a bigger population. So this is the first phase. Second is, after we have collected everything, we will define the exact problem. What is the problem? So we don't want to go with biases in mind. We go with the clean slate based on the data that you have collected. We will then synthesize and analyze all the data and the information that is collected to actually define the exact problem, understand the point of view, and come up with how might we questions to solve this particular problem that has been defined with the whole team. Then we ideate using several techniques like brainstorming, mind mapping, Scamper, whatever is suitable, to come to consensus on one best idea. Because in the ideation, the teams, which are like, 7 to 8 teams, will in their own teams come up with ideas, which we will then merge and see, and rule out things which are not feasible, and actually work out on one main idea, which would be the most feasible, depending on the three so-called stakeholders that we have identified. And then we build a prototype of the idea, or a system design of process flow, or a take-back model framework that would be on paper. And then the fifth step is test, but this is out of scope here. We are not going to test. We are only going to design it and submit it, to, if possible, to the policy department, and see how it works. Participants, as I said, this would be the three participants, and this is a design-based research. So it is concentrated, it is collaborative, it is participatory, and it is more of an educational inquiry right now. That's why we, close it at prototype. We don't go for testing. for testing, then we would probably, that would be a different research altogether. So here the basic process is to develop solutions and interventions for a particular problem that has been identified. An intervention is any interference that would modify a process or situation for a better good. And then we started with literature review. This is almost done. Literature review is done, and these are certain, it's a gist of the main, information that we collected. One, pharma supply chain is a very complex multi-stakeholder network. There are many people who are involved in it. So it's complex. Then there are various costs if this particular supply chain is not performing efficiently. Economic costs, social cost, and environmental costs are certainly there, and that's why it is a very important topic and it cannot be ignored at all. Yeah, stakeholders we've already discussed, but the other stakeholders are manufacturers, stockists, distributors, government and regulatory bodies, and the general public, which we are not focusing, in this study. And the ones which are highlighted in bold and ones which we mentioned are the only ones we are focusing on. And the end user, that is the patient's role in helping curb the expired medicines, is something that we are trying to work on in this study. And we understood through literature review that the mismanaging of unused and unexpired medicines is one, because people are not aware. Second, they don't want to be inconvenienced. If they want it to be very easy, it should be at the doorstep and it should be arranged somewhere. Somebody should arrange for it. This is the kind of attitude that people generally have here. And reasons could be changes in prescriptions or doses, recovery from illness, expiry, because you are using the medicines. Sometimes you may buy more than needed, stockpiling for future use. These are the major reasons for expiry. And the two categorization of medicine waste is, one is end of use medicines which are left unused, but they're not expired. And the other one is end of life medicines which are expired. So these are the two categories. So disposing for both would be different. For end of use, which is not expired, probably it could go back into the system. And end of life medicines which are expired has to be disposed of properly. So that's what has been identified here. And one major challenge is, I tried to understand and I tried to dig deep into the literature, existing literature. Estimating the quantity of medicine waste is challenging due to its very disposal pathways and long household retention. So, we cannot take a stock at the pharmacist to understand what would be the rate of expiry medicine. So that is a bit of ambiguous and challenging. And a very positive thing is that the extended producer's responsibility as a policy and take back programs do exist on paper at least. And maybe that's why it is not very difficult. It should be possible to work on this so that they become functional. This is the first phase that I move on to after my literature review. This is the phase one, that is empathize, where you identify the stakeholders who are involved in the issue, and then you conduct your research, survey, observation, interview them to understand more about the systems, the practices, the beliefs, perception, pain points, and motivations in which these stakeholders exist. So very much like the other participatory research, where we try to understand them and collect whatever we can, not missing out anything that they have uttered, so that it can be then later on synthesized. You never know from where you get a clue and what would be an insight that should not be missed. And that's why we try to either, record what they're saying, or we take videographs and other things. Of course, once they have given us permission that they're okay with it and that we can go ahead with it. So this is the kind of, queries and curiosities with which we went for the phase one. What is the modus operandi? Is there an existing system that is there? What are the attitudes, opinions, pain points, and hurdles of each stakeholder's representative? For example, the pharmacist says that, "Arey, हमारे यहाँ तो इतना सारा inventory is lying, expired." and these distributors never come to pick it up, and it is like, unnecessarily hoarded here. So the pharmacists are also worried about what to do with this. Yeah, so there are lots of pain points and problems that they came out with. What makes them feel good or bad about the system? What are the issues and what are their beliefs? How have they tried to resolve issues which are related to it? What is the awareness level of the consequences of improper disposal? Then what are the overt reasons for neglect of disposal? Accountability by the stakeholders. Is it lack of incentives? For example, the pharmacists are not bothered because there's no problem if the stock is 50% of the stock is not sold, and if it expired, it is not their issue. It goes back to the manufacturer. Okay, so that's where there is lack of incentive. They're not worried to maybe push off the near to expiry medicines before, so there is nothing that is seen there. There is lack of stricter compliance and regulations. There's lack of monitoring. There is inconvenience. There's cost issues. Time is a big constraint for consumers, especially, and lack of commitment. So these were the major, curiosities to understand, okay, how it is and what is the status. So visited pharmacist in a few households. We are in the phase 2 where we are going to now also visit the waste management, stakeholders. We have visited only the pharmacists majorly and few households. And we have documented every observation and primary information, and we have taken photos, videos, audio recording, and notes, etc. So these are a few observations. I've just put in a few to fit in on the slide. And you will find that there is a lot of ambiguity even with the pharmacists. Some of them are aware, like, for example, people who are with branded and standard medicines, they are a bit aware about it because probably the system is getting into place. But then if you go to generic medicine stores, you'll find that they are not at all aware of what is to be done and how it is to be handled and things like that. So there is this kind of an ambiguity. If we talk about the consumers, it was really bad to see most of them were not aware that there is a take back system. Almost all of them we met said that either we burn or we flush it off or dump in the dustbin. Okay, and it's never segregated. They don't know whether it's hazardous. They don't know what to do. So all your antibiotics and everything goes down the flush, and all these things. So that was very, very dangerous, and we were not very, sure on how to respond. Many of them would do what? They would wash the bottles, for example, syrup bottles and all, and they give it to kabadi wala because they get returned, some money out of it. So that was one incentive for them, where the syrup bottles or big bottles were, or even, plastic bottles and other things. Many people, not all, would wash and then wash where? Wash in the sink. And then they would get money out of the empty bottles. So if you see, this is something that is there, and I feel that we are at a very, very basic level of understanding that the legal compliance and other strict monitoring is lacking to quite an extent, and it also gave us some so-called positive strength that yes, we can do something about it because EPR is there, because there are things that might now become executionable. So these are some of the observations that are there. One of the observation from the consumer was, why can't we have a separate municipal waste collection vertical for medicines only? Because there are not just medicines, there are also medical waste. For example, one of the person who was a diabetic, he said that I don't know where to dispose the insulin, injections and other things. So it is all dumped, given to the municipal waste. Though there is a system where they collect waste from hospitals. So there is that exists. Yeah, but from households, it is missing. This is one of the observations. So this is phase 2, where we are going to now collect information from the waste management companies, private as well as municipal, and the third-party reverse logistics companies and vendors, which are assigned by manufacturers under the EPR scheme. Here also the same questions and the curiosity exists, but we also have some additional which I've marked and highlighted. What is the incentive of business feasibility as third-party waste? Because they could be small, very smart and very valuable contenders in this particular, waste management from consumers to disposal systems. And can household collection be infused in the system? What would be the cost, and what are their routing, scheduling, and collection cycles? All this to understand how we can plan one which could be a win-win for all the three stakeholders. So this is where we are at this particular time, and we are into the second phase, and we are going to build personas and then define. That is second week of November, because first week of November we have exams and students will not be part of it. Then second is defining the problem by synthesizing and analysis. Once the problem is defined, we then ideate for the best take back framework in the fourth week of November, and first week, ideally, the prototype and submission would be ready. So this is all that I have to share with you all. And if you have any questions, you may please ask.
Thank you, ma'am, for such an insightful presentation. I will invite Vibhuti, ma'am, for her comments and remarks before moving to the next presentation.
Thank you, Dr. Professor Ashish Sharma, and I join Omkar in saying that it was a very insightful and exhaustive presentation. The two experiences I think are very important for the policy implication. You should also add the recommendations for the local self-government bodies and the municipal corporations, municipal councils, and also the state government, because there is a law for solid and waste management which takes care of medical waste. So experiences of Trimukhi Sangatna, which does the Parisar Vikat, it has shown that because of this throwing away of injections and medical waste, it harms the waste workers who are dealing with the waste. So many injuries on their hands, sometimes even the this liquid medicine which they accidentally touch while processing the waste or separating the waste and all. So that is one aspect. Secondly, some corporate houses, especially I remember during 80s, Larsen and Toubro had already fixed up their big boxes at the important stations. In so many railway stations, you would see the medical box, no? Where you whatever unused medicines you had, that could be sent. Most of the people did not put the medicine with expired date, but even if they did, they had a classification system. At the end point, they used to classify, and the expired one were processed separately, and the other useful ones were given to charitable trust and organization. So I think that kind of thing can come under CSR if they take it up, because in whichever areas they are, if they do such kind of uh, 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 facilities, if they provide, then I think citizens can also. I think it was also done in collaboration with Dignity Foundation, the senior citizens organization, who used to actively see to it that, because there are so many needy people, especially for cancer and all, things are also expensive. So I think that is very important. So what should be done? Those recommendations should be. And doable agenda for the civil society, doable agenda for the local self-government, and doable agenda for the state. And legislation and policy we have, but there is hardly any awareness or public education about the medical waste.
Yes.
So
Sure, ma'am. Sure. Thank you so much. Thank you. Thank you.
advocacy for the public.
Thank you, ma'am. I will like to invite Tanisha Upadhyay ji. She shared a recorded video. Now I would like to request the team to kindly play the recorded video.
Omkar, we can move to the next participant and then at the end we'll play Tanisha ji's video.
Okay, ma'am. All right. I will like to invite Aparna Mishra ji. Begin with her presentation. You are not audible.
Am I audible now?
Yes, ma'am. You are audible.
Can you see my screen?
Yes, ma'am. Yes, it is visible.
Working mode.
Good everyone, I'm Aparna Mishra, and my research topic is contested wounds navigating consent, control, and state power in contraceptive adoption among marginalized women in Delhi. So, childbirth is one of the most intimate and vulnerable moments in a woman's life. It is a time when a woman deserves to be treated with compassion, with dignity and respect. Yet, for many women, this moment of care often becomes a site of quiet control. So, in the name of family planning and welfare, postpartum contraception is often presented as a medical necessity rather than a personal choice. I would like to begin with one such story. A young mother of three, Seema, who worked as a household help, had previously miscarried a baby and was grieving its loss. She had thereafter decided that she was content with the size of her family and she didn't want to have any more kids. So she went to a government-run facility, and after being counseled about her options, she got a property. She was worried about what her husband would say, but surprisingly, he was supportive of the idea and welcomed it. However, after 2 months, she started experiencing heavy and continuous bleeding, which would not subside. So she consulted the doctor, and they told her it was normal and it would take some time for her body to get accustomed to the device. This went on for a few months. She had gotten weak, and this time when she went to the hospital, she was told that she had contracted an infection because of an allergic reaction to the IUD. She was put on medication and was told that she couldn't take any oral contraceptives or injectables. The doctors advised her husband to instead use condoms. And due to a tear in the condom, they conceived a child accidentally and were told it would be dangerous to undergo an abortion because of the infection. While her husband wasn't in favor of continuing the pregnancy, but on the advice of the doctors and the family elders, they decided to go forward with it. The due date had come and gone, but Seema wasn't experiencing any labor pains. She was worried something was wrong with her baby and she rushed to the Anganwadi for help. Along with the Anganwadi worker, she went to the hospital where tests were done and she was promptly admitted. The maternity ward was brimming with patients, all waiting to give birth, 2 to 3 patients on each bed. After labor was induced and she was close to giving birth, she was made to walk to the delivery room. There were no wheelchairs around. Even in the delivery room, all the beds were occupied and there was nowhere for her to sit. So she sat on the floor, writhing in pain while she waited for her turn. After the baby was delivered, the doctors told her to get a property. She was tired and exhausted from labor and had been in the hospital since 4 p.m. and it was already 3 a.m. in the night. But she explicitly told them that she did not want to get an IUD since she had previously gotten an allergic reaction from it. Her pleas were dismissed. She was mocked and scolded for having had so many children. That people like her, they gave birth to 3, 4 children, and they continue to do so. They told her they wouldn't let her go or allow her to see her baby until she got an IUD. She was made to sit in the corner in the delivery room for hours. It was 8 a.m. in the morning now, and she was desperate and restless. Her baby was crying outside, and so she gave in. She succumbed to the pressure, and she got a property inserted. She had even pleaded with them that, after 2, 3 months, like I myself, I don't want to give birth to any more children. I'm happy with the size of my family. I would come back and uh, get a sterilization procedure done because anyway, the IUD does not suit me. But they had insisted, so she had to succumb because how long would she have waited there? And just like clockwork, once she had the property inserted, after 2, 3 months, when she started menstruating again, excessive and continuous bleeding started. She contracted the infection once again, and this time she was hesitant to go back to a public healthcare facility. So she went to a private clinic and got the device removed. Stories like Seema's are not isolated incidents. They are part of a much larger pattern. To understand why such practices persist, we need to step back and look at the broader policy environment that shapes reproductive healthcare in India. So I have made these two paintings to show women's reproductive choices, particularly of those from marginalized communities, how they are often governed by institutional assumptions rather than individual choice and consent, and how these women, they resist and negotiate the terms of their autonomy. Um, so India was the first country in the world to implement a national program for family planning in the year 1952. The program emerged primarily as a population control measure. It is also worth noting that the Indian government's fascination with family planning predates the enactment of the national program for family planning. The genesis of the debate can be traced back to the colonial times when the intellectual traditions of neo-Malthusianism and eugenics were dominant. So in my MPhil dissertation, I have argued that the imperial imaginings of the discourse, the imperial and colonial imaginings of the discourse had pervaded the imaginations of the policy makers, and this is continued on. So in the sense that women from less privileged backgrounds are still made to bear an unequal burden of reproductive politics. Today, despite falling fertility rates, the legacy of this demographic anxiety of a population explosion, so to say, continue to shape how women's bodies, especially those of marginalized women, are governed. This presents a paradox. While population growth anxieties have receded, the state and institutional practices, they continue to treat certain groups of women as targets. Understanding this paradox requires moving beyond policy documents and demographic data to the lived realities of the women who inhabit these systems. To capture these everyday negotiations between policy, healthcare, and personal agency, I turn to the field. My fieldwork is still ongoing. I'm conducting my research in Delhi's Northwest District, which is the most populous district in the city. I'm employing snowball sampling to identify the participants and conducting in-depth semi-structured interviews of women between the age group of 20 to 40, belonging to poor and marginalized communities. So I will have more to add and share at a later stage once I've completed my fieldwork. So moving on to some observations and some things that I feel are necessary going forward. I believe contraceptive technologies can play a crucial role in enhancing a woman's bodily autonomy and agency, and they have the potential to allow them to determine the trajectory of their lives. But this can only happen when these are offered as choices and not imposed upon as mandates. So I have listed a few suggestions: robust training and sensitization of healthcare professionals, more ethical counseling, accountability in care, and transparent redressal mechanisms. Because in many cases, even when the patients go back to complain, their grievances are not addressed. They're just sent away. And the hospitals don't take cognizance of what is happening, which is again a sad reality that they have to contend with. So because of this, I believe it is important that policy should be shaped by the voices of the marginalized, and their experiences should be taken into account. To conclude, I would just like to leave you with a small question: whose bodies, whose choices? Thank you.
Thank you, Aparna ji, for your insightful
Thank you, Aparnaji, for such a well-grounded and data-driven presentation, especially the findings that, especially your case studies are extremely powerful. That reminds us of the 75 emergency rule where millions of people were forcibly sterilized and brutalized. But I think in the current context, like you need to give the macro profile also, because out of 36 days, only 31 31 have already reached stabilization. So this whole sycophancy of population control, which is nothing but stigmatizing and brutalizing the people, because they are not so crude as they used to be in when we were doing research 50 years back, where they used to say that poor people are seeing babies like cats and rats, and they need to be controlled. Even medical social workers, the psychiatric social workers in the hospitals, they also use the language of Nazi scientists. No? So that I think that has gone, but still the bias remains. So I think except for Bihar, Jharkhand, Meghalaya, Manipur, and UP, you don't have. In all other states, it has been below stabilization. All nearly 12 states are below stabilization. So the couples are replaced by less than 2 children. So that is already there. So it is basically the legacy and the whole the way whole sycophancy against poverty groups is built. I think that you should bring out sharply and at this point that and even in 2011, 8 states had become below stabilization, and now we have 31 states which are below stabilization. Because that was the 2004 when the argument which was given by in the common minimum program was that we are going to target 300 blocks where TFR is more than 50. So that is achieved, and the processes were also extremely brutal. There are the reports after reports by Sama and Janaswasthya Abhiyan, which has shown that how this camp approach of herding poor people without any sanitation or without any fumigation within, or what they call it, aseptic environment being created in the outing, is right in open without cleaning the instruments on a mass scale. You do sterilization. 123 women died in Chhattisgarh. No? So this is the reality now also, may not be in such a large number, but I think that has to be so full violation of human rights, women's bodily integrity, and the sanctity of an individual. That's what the Constitution talks about. So those aspects also, I think we should weave into. But others, yours is a very, very powerful analysis as well as. But this question of TFR should be brought up. The whole madness about population stabilization, which used to be there 50 years back, and now it's.
Thank you so much for your valuable feedback, ma'am. We included in my research.
Yes.
Thank you, ma'am. I would like to invite Atulya Devji to begin with the presentation.
Hi, good morning, ma'am. Hello, everyone. And I hope I'm audible. I'll start sharing my screen.
Yes, ma'am.
Is that visible?
Yes.
Okay. First. So to begin introducing my study topic, so the study topic is Stewards of the Great Kerala Kitchen, understanding the behavioral drivers of food choices and homemakers across the obesity status in Kerala. The idea of the study was to understand the homemakers or the women perspective, because they are the primary decision makers of the household food choices in Kerala. Given the huge gap between policies and interventions, mostly today, even though we understand the epidemic or the kind of relevance that India holds in the topmost ranking in obesity and diabetes and other non-communicable diseases all over the globe, still most of the interventions and policies are inclined moreover to the pharmacological medical advancement or those kind of interventions moreover than the psychological and understanding from the patients or the participants or the community perspective that how things can be tailored or engagement and adherence and compliance can be made better for them. Lack of evidences will lead to the less success of policies for sure. So the study is actually more oriented in order to lay down more stronger and robust evidence out there in order to understand from the perspective of the holders of the kitchen, to understand how they make the decisions so that more engagement based interventions can be tailored for them. Yeah, talking about the background. So the first thing is as I said, that the obesity prevalence in India is quite high. Why the Kerala is being chosen is because of the NFHS 5 in the 2019 to 2021 report, Kerala ranks among the highest in obesity and diabetes, with 36.4% of men and 38.1% of women aged between 15 to 49 years who are overweight and obese. Here also the women, the prevalence of obesity and overweight status in women is higher than men. And at the same time, one of the most relevant studies, which was based on diabetes prevention and non-communicable disease prevention program, which was implemented in Kerala, published in a study, Devidanam ETAL 2015, which also stated or concluded that the women's roles is the primary, or that gender-based role is what shapes the household food procurement and consumption, especially in the resource limited rural setting, which was implemented in Kerala. And one of the major factor which popped out in another study in Morgation ETAL 2017, which he published, that the low awareness amongst the communities about the disease prevention is one of the major factors leading to or adding to the rising epidemic or rising non-communicable diseases in India. Here also they had figured out that the high level education gaining individuals showed more awareness, and also the people who are more over the executives or those kind of occupation which reflects more literacy had a stronger level of awareness in order to make much more smarter decisions. Talking about the research question, exactly, the study is oriented to answer what socio-cultural and household level barriers what socio-cultural and household level barriers hinders the healthy food choices amongst the homemakers in Kerala, leading to an increased obesity risk. So the behavioral factors are the major decision behind the decision making of food choices in Kerala will be explored in this study. The methodology designed for the study is a qualitative, it's cross-sectional, and all the purposive sampling or the snowballing sampling is being done in order to recruit the participants based on their consent, and also understanding from the visual perspective about the obesity markers of the family members. Just by visually seeing, by understanding the family members, will be able to give us much more idea about the obesity-based decision making. In-depth semi-structured interviews are conducted, 30 to 40 minutes for each participant, and then leading forward to thematic analysis is being conducted based on sociological model. The tool, which is customized or tailored for this study purpose, covers all the basic major components here mentioned. Role and background is the first thing, asking the participant, and then second about how they are making their food purchasing decisions, what kind of food is procured mostly in their households and where they are procuring that from. Cooking and meal preparation, so what kind of are they using much more oil in the cooking, what kind of traditional practices, what kind of modern and convenience based cooking practices they are following. Health beliefs and practices, so what is the culture, is the traditional health and beliefs is what they are actually following, or some kind of modern influences are there in their practices. What are the cultural and social influences happened in their choices, and how their decisions are being oriented across the different kind of religion that they follow. Convenience and modern influences, if they are working or non-working, and if they are working, how do they manage the cooking at households, how they are able to get the time, what are the preferences when they are thinking about the food procurement from that perspective. Portion sizes, what kind of portion size is standard for the family and for themselves from the individual and also for the family perspective, and what are the eating patterns that they follow. And finally, we are asking just if they have any kind of reflections or any kind of feedbacks for improvising the schemes that can be tailored, or how they can get to much more healthier choices in their households. From the interviews or the preliminary findings, we could understand one thing majorly, that it's because of the broader dynamics and the broader factors which are being extracted from the interviews. In 2016, John Hopkinson University has devised the SEM model, that's socio-ecological model, where the broad perspectives or the behavioral, these kind of patterns, mostly for the non-communicable diseases, it can be laid down and can be understood in different level on how the interaction is with the behavior at different levels. So at beginning with the first level, that is the individual or that individual level, we can understand that the personal beliefs of that women is especially influencing, and what kind of preference and skills does she have is also influencing her decision making and towards food. What awareness does she stand, and what kind of attitude does she have? Is it just about getting the food and getting done with the day, or is it about satisfying the family, or they are making healthier choices consciously? When talking about the interpersonal or family level, we have experienced different factors such as social relationship, what kind of dynamics the family has, and how much power the women holds over the decisions, and also the autonomy she holds in the family dynamics is very important when considering the power over the decisions. General role is also one of the more important, as we discussed. The gender role is one of the things that make her understood in a silent way that she is the one responsible for the whole family's meals and decisions of the food. Family support plays a very major role because if they are cooperative, only then the decision made by the women will be adapted and accepted very much uniformly between the family members. Talking about the third level, community basis, there is traditions followed in a geographic area. What are the religious practices? What is the social network of the people that there is? What is the prestige? There's also this factor that came out that there's a prestige factor linked with the food, where neighbors are very much interested or curious to know about what kind of food is being cooked at your household, and that also shows your socioeconomic status of the family. So that factor also played an important role, or it also came out a significant factor or a theme contributing to the women's decision. Then talking about the next one is the environmental factors, where what kind of position or where availability, accessibility, affordability, all of these things um, all together play an important role in the food environment where they are living and what kind of procurement they are doing at their household level. And also the delivery cultures now today, based on the social media and online convenience based convenience influence on the food decision making, we can say that most of the household level decisions are based on the convenience also, that if the delivery option is still available, they'll easily go out that today we are tired after work. And if that availability is only there, then the environmental role comes into play, that only if the availability of the delivery options or those applications are applicable over that location, then the environmental factors or the delivery factor does play a role. Policy level, what are the price subsidies, ration system, if there are education or awareness campaigns around nutrition, women empowerment, employment schemes available, that also plays an influence in that decision making. What kind of policies can be recommended out of these findings, though the study is still ongoing and the findings are not robust enough in order to suggest any kind of policies, but the themes emerging can of course add on to the with the existing evidences can add on to the recommendations by these policies, that nutritional education should be implemented for a household change. Family centered counseling will be helpful in order to improve the women autonomy in a family dynamics. Skill building for homemakers should be promoted, because if the homemakers are not having the powerful autonomy in the decision making at the household, their decisions, no matter if they are choosing the healthy choices or opting for a healthier version of their family, will be eliminated or will be omitted completely, will be ignored. So skill building for homemakers to feel them empowered and also to create much more value within the family should be encouraged. Enhancing women's autonomy and promoting the culturally tailored interventions, because culturally tailored interventions will be respecting their cultures, religions, and will gain more engagement and adherence than the national guidelines, which is uniformly implemented all over the region. Regulating the unhealthy food market should also be done, because there is misinterpretation of the labels. The social media networks and all of these things come into a play where different age groups in together are living in a household. In the existence of children in the household, we can say that the media or any kind of beautiful packaging or advertisements play a very major role in women's decision making. So that's a wrap. That's all for the presentation so far. Actually, still I need to conduct more interviews to gain more insights with the topic.
Thank you, Ataleji, for your insightful presentation. I would like to invite Vibhuti ma'am for her comment and remark before moving toward the next presenter.
Julia, for your ground level work. Uh, yeah, yeah. So I think your research is robust, but my problem is about the implications, because you are putting whole burden only on households. What about the corporate world, food processing and food production industry? What about the advertisement? I remember when the advertisement on the processed milk came, children refused to drink milk which mother gave, not the Bonvita or all. Or when it came to Kellogg's was aggressively advertising, our children refused to have batata poha and upma and dosa and this. So I think and what should be the guidelines even for the advertisement industries which are promoting aggressively all this unhygienic food and which creates so many problems because the salt level, uh, oil content, fat content, and also in the soft drinks, the amount of sugar is being used. So for them, you are not your recommendations are not there because after all, everybody gets captivated by these family members also demonize women if they don't make that kind of food. No? They have to have. I remember when my daughter was growing up, all children, any nice food, homemade food you serve during birthday party, they were fixated only about rasna and chips. The children, if you did not have any rasna or chips in the party, that party was of no use. Even that housewife would have spent whole day in cooking nice, delicious dishes, no homemade dishes. So I think the regulatory provisions for the for the manufacturing, food processing, and food production companies, because now they are corporate. It's a FMCG, fast moving consumer items are a big they are the only ones, even during the recession, they did not have loss. No? Even when the global crisis happened, it was only FMCG which was making profit. So, because everyone needs to eat food, even during the pandemic, the FMCG did not have face problem because their products were being sold. Plus, the kind of responsibility of the advertisers, the way Ladley Media Award does it about the gender equality. Similarly, can we do about the healthy India? No, the way we talk about the Swachh Bharat, can we talk about the Swasth Bharat? And in Swasth Bharat, what should be the responsibility of the corporates, of the media, and things about the directives to the school canteens. I think some states have done. But what should be the directive given to school canteen? Because most of the time children are in nearly their 6 to 8 hours they are in school, and so many of them buy things from the school canteen. And also the directive to hotel and restaurant industry. I think some of the European countries have done it. Can we do that? That what kind of food they should serve to the citizens so that they know the level of oil or level of salt. I think about salt, a lot of the medical lobby has been also organized, and they are also discussing with the government that we need to create certain standards of the level of oil and salt that is used. So I think those kind of policy as also you should say. Otherwise, what happens that if there is obesity in your family, everyone will blame housewife. Housewife is also doing things because of the pressure she has from the family members, and maybe she's also convinced with all these ads. And so the larger macro aspect you should bring out, both in your introduction and review of literature, and also in your recommendation.
Like by the end of the thematic analysis, we can do a categorization of a modifiable and non-modifiable, like at the household level modifiable, household level non-modifiable factors I can segregate, and then showcase that if the people themselves they want to change, these factors can be emphasized, and externally the policies and the government and all other factors should be working on the non-modifiable factors that can be done by the end.
In public education, so many research is about the mortality. You die young when you are obese, no? And all that. And little modification, not much in taste. Like in my case, if I say I lost 14 kg after just changing the diet. It's not that my food is tasteless. It is there only for the oil consumption, oil and salt are controlled.
Awareness is a
So,
big problem. Actually, awareness and making the smarter choices being like once the options are being spread around, asking people to make the smarter choices. Do you have the awareness of which is good for you and how much that is harming you? Are you consciously eating the unhealthy food or unconsciously eating unhealthy food? That is one of the biggest role player. Once we are aware that this is harmful, then we will consciously make a decision. This is once in a week, once in a month kind of decision. But otherwise, we'll keep on munching that without even realizing that yeah, it's okay. What's the big deal?
The pressure, like we in our Indian Council of Basic Education, we are running an early childhood school. We had to close the canteen. We were serving nice, healthy meal, chapati, bhaji, dal, and rice. But the parents also said our children want Chinese food. Children want whatever they were saying. This, you know. So now we have closed. I said okay, and these children are now eating only packaged food, packaged snacks, no? Which earlier we used to be such healthy things. So I think the power of advertisement, power of corporate, very aggressive. Even if you go in the deep forest, You won't get anything else, but you would get all this packaged stuff. Other things won't be there. Drinking water may not be there, but you would get all the. So that is the reach. And for if that is not regulated, then the whole population is. So I think that also should be there. And
It
that
might
can
be,
be at the policy level.
it
Meaning,
will
because
be
now
very
we have a
actually insightful to learn about the fact that is the objective being accomplished by all the bodies together? Like if we want a healthy India, are all the bodies working together in order to achieve it, or which all are resisting that kind of idea of healthy? Because there are so many loopholes within the regulations of FSA that when companies when come to their production, their labels and everything, they will easily put as a disclaimer that you have to understand that this is not ORS or this has a sugar amount of this. It's so much smallly like in a font written that people cannot even observe, and most of the illiterate people don't even think about what they're buying. It's just about palate. It's about the sense.
from farm to thali. Farm produce is nice thing because the kind of variety we have 200 variety of rice, we have ample variety of food. So the problem is not of a farm. From the time it reaches from farm to plate, I think a lot of garbage takes place, and that I think you need to focus on that. Otherwise, what happens? We will end up blaming victim because victim blaming should not be done because women have to cook. That's their responsibility. They are the annapurna. But it is not they who are responsible for the choices. There are so many factors, multiple factors, which are creating this kind of unhealthy diet for the Indian population.
Sure.
So that's
Thank you so much.
okay. Yeah. Have you gone through literature from National Institute of Nutrition, NIN?
Ma'am, guidelines regarding the
Guidelines and also the surveys.
Yes, ma'am.
Like these surveys
Yeah.
are
Yes, ma'am. And I will have it.
diabetes, heart problem, this thing, hypertension,
Yes,
blood pressure. Their studies are there.
yes,
Yeah,
ma'am. I'm
so
concurrently actually working on with type 2 diabetes patients itself. So my other study is actually with type 2 diabetes. So I'm quite like it's a good base of foundation for also building on obesity and this qualitative study.
yeah, thank you.
Thank you.
All the best.
Thank you, ma'am. I would like to invite Rishabh Singh ji to present his presentation.
Omka, I think we can go to next. Rishabh is not there in the meeting.
Okay, so this is my meeting next. I'll start to present myself. I hope is it visible.
Yes, it is.
Good afternoon to everyone. This is Omkar, pursuing Masters in Public Policy and Governance from Tata Institute of Social Science, Hyderabad campus. My topic's name is bridging the bridging the learning gaps, interstate poverty, health, social infrastructure, population, and AI strategy in the Nipun Bharat mission. Yeah. So Nipun Bharat mission was launched by Government of India in 2021 under the Sarva Shiksha Abhiyan. Main aim of this mission is to achieve ensure every child achieve foundational uh, according to the report, despite having high enrollment, India faces the systematic learning failures like the access issue, equity challenges, quality gaps. In the access issue, there are issues like there is a rural and urban divide. Still, there is a digital divide among the rural India and urban India. That's why rural India children facing a lot of issue to access the quality of education. There is the equity challenges. In the equity challenges, there is not equitably available of resources between the rural and urban India. Marginalized and tribal student still facing a lot of issue like the nutritional deficiency. Due to this overall affect the education outcome. In the quality gaps, there is a lack of infrastructure. There is there is lack of infrastructure, modern technology like the AI, machine learning, and there is also lack of pupil to teacher ratio. That is the lack of teacher training, teacher to fulfill ratio training gaps. That's how access to equity challenges and quality gaps affecting the overall outcome of Nipun Bharat mission. During the before COVID-19, learning poverty gap was 56.1% according to the reporters. After COVID-19, according to the ASER survey, that 92.1% student lose their at least one language skill ability and cognitive skill. So that is the overall issue faced by the student. Rural class 3 students especially lag in the core literacy and numeracy skills. Some, despite having there is some achievement, according to the ASER report, there's 7% increase in the reading and subtraction skill at the national level. According to the report that UP, especially in the Uttar Pradesh, 12 to 14 points increase in the reading and subtraction skill. Tamil Nadu also doing very good in the contextual learning. 70% of students read and add the two-digit numbers. So this study is examining interstate variation, infrastructure and social challenges, potential of AI-driven strategies to transform foundational literacy and numeracy outcome. What is the research objective of my study? To analyze interstate variation in foundational learning outcome under the Nipun Bharat, assess the poverty, health, infrastructure, state funding, policy factor, and explore the role of technology and AI strategies for achieving the universal FLN by 2026. Key research question: what are the core challenges and gaps impacting the success of Nipun Bharat across the Indian state? That is, the some state like the Kerala, Tamil Nadu, Karnataka are performing very well in the FLN, but state like the Bihar, UP, Jharkhand, Chhattisgarh still facing the lot of problems. So why there is a still gap between the gap among the state to pursuing the to achieve the objective of Nipun Bharat mission? How do poverty, health, and infrastructure influence the foundation learning outcome? If there is a more poverty, there is more nutrition dependency, health challenges, infrastructure gap. This overall affect the foundational literacy outcome. What are the interventions, particularly AI-based technology aided, and can we bridge this gap to achieve the universal FLN by 2026? That are the main three questions, research question I'm working on. About the literature review, Kumar 2025 literature discusses about the immense learning poverty. That is, before the COVID-19, there was 56.1% learning poverty in India. That should be the need for the tech-driven solutions, individual learning. It discusses about the how National Education Policy 2021 talking about the AI education and how it's impacting the overall education outcome. Second literature highlights the varying state outcome and localized strategy. It discusses about the how different state pursuing the various AI-driven strategy to ensure the FLN outcome. Like the Tamil Nadu has started the Inam Azuntham, which is introducing the AI strategy and contextualized approach in the education learning. Third literature, we discussed about the how poverty, nutrition, and maternal education drive the disparity and how it affects the overall FLN outcome. Fourth literature document improvement in the UP and Bihar through the focus strategies that we have already discussed in the previous slide. Fifth is the how pandemic impact the education outcome in India. It discusses about the persistent training to the teacher and infrastructure gaps. Let's talk about the socio-economic barriers that affect the outcome of FLN. And there is also UNESCO study which is discussed about the how Brazil AI-driven model, that is a Literacy and Geeky, that we discussed about the human AI collaboration model that will give the feedback to students based on the human and AI approach, that is a hybrid approach, which is a very low cost solution as a resource limited models that will also we can implement at the India level. What is the methodology I am following? So this study is driven by the mixed methodology approach. I am following the NFHS, ASER, TVS survey, that is the report and secondary resources. Literature review of the national and international case studies on technology integration in the foundational literacy. It identification of the bottlenecks and policy recommendation focusing on the digital and AI-enabled infrastructure for the FLN outcome. And secondary data analysis of the ASER survey, NFHS 2029-20 report, Niti Aayog poverty index, and state budget report. How state education funding overall affect the overall education outcome? How many states allocate how many percentage of their state GDP to the education, and how it impact the overall education outcome? Comparative analysis of the state policy document and successful intervention. So this is the methodology that is how I'm working on this paper, and I am acknowledging that to the entire IMPRI team that for their consistent support, and especially for the Vibhuti Patel ji ma'am for her invaluable mentorship and insightful feedback. Thank you.
Thank you, Omkar, for your insightful presentation. Ma'am, I would like to invite you for your remarks.
So I think, Omkar, you have made a very exhaustive presentation and you are focusing on how technology is going to facilitate. But I think when you give the example of Brazil, AI works when other material things are also there. For example, massive problem of child labor, which Brazil faced. They came up with a conditional cash transfer. We have conditional cash transfer scheme for Beti Bacha. If you don't kill your daughter, state will support and give the bond and uh, incentivize the girl child. So by the time she's 21, she'll get 1 lakh rupees from the state to build. But for education, I think far more supportive infrastructure. Basically, you should say that AI can be effective, but at the same time, what you need is a safe transfer from home to school, plus more quality education, democratization of classroom, and economic hardship which the parents are facing. Wherever the midday meal programs in the school are very good, efficiently learned, students get a very good meal, either because of collaboration with NGO or some of the states in Tamil Nadu, the way it has organized midday meal program. Children want to go. There is no absenteeism, there is no dropping out. Plus toilet facilities, no, especially for the girls, toilet facilities with running water and also safe toilets. It should not be in some corner where they are kidnapped from police. So, given all this facilitating ecosystem, AI can do. AI in the absence of this cannot be. So that is very interesting. That is what we see even about the drone didi. No? Why drone didi in Haryana is effective, while the same drone didi program in some other state, it has just not clicked because that kind of a basic facilitating environment is not there. So your information you have given about Tikun Bharat is fine, but also talk about the background in which it has to happen. Even ASA report talks about it. That what all we need, because we always see uh, non-planned grant, the budget. First of all, the education budget itself is less than 3% in India, which the national education policy demands 6%. Minimum 6% of GDP should be allocated to education. And within that also, plan and non-plan, we don't consider a non-plan fund as a productive, which is very important. If you see the probe report, have you gone through probe report by Anita
No, ma'am.
Rampal and Anil
No,
Sargopal,
ma'am.
which talks that
No,
don't
ma'am.
non-plan grant as a burden. Non-plan grant is very much required. You need good school building. You need good playground. You need running water. You need electricity. These are the non-planned and your recurring costs. No, if you once you install computer, the recurring cost will go in non-planned grant. You need it, otherwise computer lab will be there, but computer are not functioning. So I think those issues also you should. I strongly request you to go through probe report. Probe report can be downloaded from internet. Anil Sadgopal and Nita Rampal, they are the two main this thing, and which resulted. It was the probe report which gave us Sarva Shiksha Abhiyan. No, the recommendations of probe report which said that you improve the infrastructure, make school so likable the children can run to it. No, so that you have. So you talk about advantages of AI, but this kind of a physical this quality education and physical infrastructure is extremely important to be for the AI to be most effective. So that is my
Yes.
suggestion. Yes.
Yes, ma'am. Thank you. Thank you.
Yeah. And you will get the insights from the probe report. Because a very lot of work had gone into that.
Yes, ma'am. Yes, ma'am. Sure. I will look into it.
Yeah.
Thank you for your feedback. Right. After that, I would like to invite Melvina David ji to start presentation.
Just give me a minute. Is my screen visible?
Yes, the screen is visible.
Yeah, so good afternoon, everybody. This is Melvin David. I'm founder at Visionities. It's a vision-related organization, and I'm also working as a senior clinical and digital optometrist and an entrepreneur owning a clothing company. Um, so, no, my study, this is my first qualitative study. So, my study topic is blurry futures, understanding the impact of uncorrected vision on aspirations and self-perception among adolescents in particularly low-income communities. So the thing is, URE means uncorrected refractive errors. So URE is the estimated global productivity loss of almost $411 annually. So this is responsible for 6.3 million lost school years and 173 billion in direct economic losses worldwide each year. So if you look at India, so 8 to 11% children have refractive errors, with higher risk among urban populations and girls. So globally, if you think, if you take adolescent refractive error burden increased by 8% from 1990 to this 2020, this 20, 30 years, it's increased by 8% driven by population growth and urbanization. So children with untreated vision problems consistently score lower. So this we all know. So I will just come to that. So in reading and math and high class failure rates and poor academic engagement, there are a lot of studies to prove all these things. So but affordable eyeglasses in China have the risk of class failure and narrow achievement gap in disadvantaged. Uh, Despite large school vision screening programs in India, up to 25% of students still have undiagnosed URE. So this only talks about the school vision screening. I just come to the next point. Adolescents and uncorrected vision report lower quality of life, reduced social participation, and higher anxiety and depression, particularly among girls who face spectacle stigma in this modern era that we have no doubt. Vision problems remain the second most common cause of blindness among Indian children. School-based vision screening and spectacle provision yield about 5 to 65 times return on investment to improve education and future productivity. This is a very important point that we have to note down. So my research objectives went ahead like, I mean, it's still going on. I've just finished my two sets up. This is the first one. Understand how uncorrected vision affects self-worth and confidence. Explore the link between the vision health and aspirations. This is nothing to look in quantitative as we are going to do qualitative, as we are doing qualitative things. So just to get people's opinion on how they are connecting their vision health with aspirations. Have they ever done it? So identify barriers to accessing eye care from their point of view. What are the barriers? Leaving the data and stuff. What the people think. In low income settings. That's the most important thing. So involve adolescents in communities to participation methods like vision diaries and aspiration mapping, problem she analyzes. So methodology and field experience. This is technically PAR, participate action research. So interview, storytelling, phone calls, and all the other participatory tools are connected. So if you see the field visit conducted in, I've conducted one field visit in a tribal rural area in Palani Hills in Tamil Nadu. I'll share about that. So I've conducted an interview. I met people with a support letter from IMPRI, and I've contacted a vision hospital from Northern Cheltenham with their tools, with their help, vision chart and everything. I was able to go and meet. So in this, I didn't meet. I'm doing this. I'm meeting optometrists, optometry students, ophthalmologists to check that's going on. So now I have finished the first phase. So I've conducted a small vision screening camp in a tribal area to know their vision first and to talk to them later. So this I talked later. I met an individual and a psychological impact and all of that. Okay, so this one case study I would like to present. Just I'll go through it very fast. So basically, this is Mr. Benil, 20 years old. He's a physiotherapy student. Um, Okay, so when you think about this particular case, he was the late awareness was he didn't know up to his fifth, sixth standard. He didn't know that vision would be like this. He thought it will be blur for everybody. He thought the board will be blur for everybody. Everybody have to go near and see. So that awareness was not there. So the avoided interactions, events. You cannot go for games or events that no without glasses. So that all was avoided, and participation avoided outdoor sports. He personally said, I have the documentation. He said that he had huge aspiration for outdoor games just because his power is huge. His power is -6. If anybody is wearing glass, you will understand. If the glass falls off, for example, if you play football and the glass falls off, you cannot see the ball. You cannot see anybody. Your vision will be only 2 meters. So because of those issues, basketball and all of those games, he chose not to play, and that aspiration he had dreams for that. That's what he's mentioning, and that was left out. So emotional impact, he sometimes felt left out and insecure because of this particular thing, because he feels that the spectacle stigma is also he has a little bit, not so much. Realization, this is a very important thing. He said when he first wore glasses, it felt like a new world. He says, I could see the bird on the sky. I thought we could never see that unless and until it comes to us. So he thought, he told me that clouds were very clear when I wore for the first time. I never knew world was this clear. That was first realization. So this is to mention, how a beautiful and impactful impact that good vision can mean to people. Barriers, he about from his conversation, lack of awareness, that's what he says caused. Because if you think about -6 glasses, it will be very thick and people buy thin glasses just to look cosmetically good. And if you lose a specs, for you to make a specs, it will take minimum 4 to 5 days, even if you go anywhere. And if your power is different, it might take 1 week also. So that is why people do not take a risk to play games or go out somewhere and explore some places. He meant that he would never go to waterfall. He would never enjoy with his friends. I mean, like he choose things where he might not lose his specs. He has to think about his specs always, because cost is so much, and he cannot buy contact lenses, and fear of power increase as well. So he himself suggested school and social media awareness can be given now, because social media has been used regularly. So government can do some advertisements, or schools can do some activities regarding the same. So this was sentence from him. I never really worried about my vision till my fifth grade, because I assumed everyone saw the same way I did. I think this is a powerful statement from the individual. And this is the next thing. What is the last one? I'll go first on this. So this is Mr. Murugan, is a illiterate from a tribal area that I've conducted my interview. He has had degrees tuition for the past 8 years, and he was not very comfortable sharing all the informations, and he was not sure about what he could share, and so I don't think he shared all the informations. But anyway, he currently sees up to only 3 meters. Okay, I could possibly think that he got some nerve problems because he doesn't have any documents, so I do not know what his condition is. But at the age of late 20s only he experienced, but he says that he had vision problem from his early 20s. He's a tribal guy. He never went to school. With the limited awareness and access to care, he has withdrawn from work and social engagement, expressing regret that poor vision has restricted his ability to support his family. The story highlights how untreated vision issues in adolescence can continue to affect livelihood, confidence, and well-being in adulthood, underscoring the urgent need for early intervention and community level awareness. So this is the sentence that he has told. If my sight was good, I could have provided for my family by going to some job. Yeah, so these are the two things I wanted to say. There are some other things as well. So these are learnings from learnings and reflections till now. So many adolescents normalize poor vision, because unless and until you wear specs and you see, you will never know what is your vision, because this is not something that can be shown, because you can show somebody this is the good food that you have to eat, and if you don't eat, you'll become like that. But in vision wise, this is something that you see, and this is very subjective. That is the main problem. You can never describe anybody how a good vision look like. I don't think all of them know. So that is the problem. So each person should be met personally, then they should experience it, what is the real. And if somebody has bad vision, you can never explain them what is a good vision. So that is the main problem we have in vision related things. So, vision is just quietly shrink aspirations and confidence. This is also purely subjective. You cannot be documented. It's not quantitative. Economic hardship and lack of awareness delay care. If your power is more than 10, you cannot brush your teeth without your specs. So so you will have a fear of losing your specs, so you will avoid activities. That I came to know about by these interviews. So teachers often play a key role in early identification, so need both psychological and clinical interventions in this. The problem tree summary is basically roots of the lack of awareness and poverty. And I would like to add one more things also, because a lot of I'll do it in the next slide. The trunk is uncorrected vision. So branches are, you can consider low confidence, missed opportunities, limited aspirations. So I would like to just go through this current schemes. I wouldn't want to explain. You can find it in Google, normal Google or ChatGPT. This is schemes that we have right now. So I would like to point out this national program for NPC this is in 1976. This is there, and they support free eye exams, cataracts, surgeries, and provision of spectacles, and all those things. And these are the schemes that more or like they're all the same. But if you look at this, the main thing is current programs focus largely on school-based screening. Here the thing comes. What about the people who do not go to school? What about the people who do not study? What about the people who cannot afford school? Because I know in Tamil Nadu there are, as we have seen in the previous studies as well, Tamil Nadu is being, getting more numbers in attendance and all of those things. But still, if you go to the route, there are people who are not going to school. There are people who do not have Aadhaar card. Tribal people who do not have a community certificate. I think we all know that if you don't have community certificate, you cannot get into some schemes. So they don't go to school. So I saw with my real eyes. So when you do screening in school based, these all students left out. I would like to add one more things also. If you see all the, this is not a very serious comment that I'm making, but if you see all the people who are good at some work, they'll be wearing specs. I'm thinking that we might lose some good human resource if you're not providing a good vision care. We can get so many good people out of these people, much talented people, if you give a good vision to them, if you show them what the real world is. So these are my suggestions that I have planted out. Mobile and community eye health units we can do. Community health worker integration, we can train Anganwadi staff, village health workers to reach out people who are not able to access public platform, because students you can access only in schools. So you have to go and reach out people who are not coming to school, who are going to work. Tribal people, low income people. Those people you have to take care, and we can use teleoptometry. Teleoptometry is something that we optometrists appear on screen, and then we with adjustment, with the help of somebody, we test their eyes with AA screening and all those. This is a new technology. So we can have this health chaos at public places, instant livelihood linkages, free spectacles. This all can happen only when you reach out. This all is inclusive data mapping, culturally tailored awareness campaigns, triple P models, involve NGOs. These are all things happening. You might have questions about, there are multiple camps happening, so many NGOs are there, but still, why there are people like this? That is the main point of the study, because they all go to school. That is the problem. So these people left out. These people are working with their mother and dad. So people are not reaching out to them. That is another problem. I would like to summarize this way: integrate vision screening with adolescent mental health programs that can be, done. Schools as early screening and awareness hubs. Even in many government schools, these programs are skipped. And promote youth-led advocacy and vision awareness. That's the main thing. So awareness you have to do. Now everybody is using phones. If you see all the tribal people, they're also having phone. They're also going through YouTube's. And that awareness can be given in a very creative way. Can be given by some actors. Emphasizing on the vision, because vision is very, very important. You don't see, you don't study. If you cannot see a book, you cannot study. That's the main thing that we have to look upon. Encourage peer sharing and vision diaries. People should be comfortable to tell people that they're not able to see or something, they're not able to speak that. They should tell the parents that they didn't write the exam if it is true, because they didn't see the board or they were having some difficulty. So vision is not just what we see with our eyes, it's what we believe we can become. I think that's right. So this is the pictures I would like to share. This is the one community that I met. It's near in Palani Hills. They are tribal people. They do not have a permanent house. They don't have pattasita. They're living in these small hills, and this is how the vision chart was placed to check their vision. And this is their houses. This is me, white. I was checking the vision. And here is one more area. If you see this white part in a stick, that's the vision chart. This is their house. This is their kitchen. You see the kitchen, it's all open. Yeah, anyway, that's out of the topic. Yeah, this is what I would like to share, and this is my first qualitative research. And if my community members find it a little strange, I please pardon. This is my first experience doing qualitative study. I think in upcoming days, in next phases, we will be able to find more impactful things to come up with better solutions and better policy recommendations. So thanks so much for this opportunity, Impri. It's been great, great learning as well. Yeah, thank you so much.
Thank you, sir, for your insightful presentation. Then I invite Vibhuti ma'am for her comments and remarks before moving to the next presenter.
Thank you, Mr. Melvin, for such a
Thank you.
passionate presentation. I think you have done a very good job of doing ground level data, and also you have brought photographic evidences. I have two issues. One is about the standard of beauty. I have worked with educational institutions of women, and even so many times they are not able to see anything from the blackboard, and we tell them that it is possible. There are philanthropic institutions which are also giving the specs at a nominal rate, like so for 100 rupees. No, that's the nominal charge you have to pay. But still, these girls won't wear because they say that they will it will affect their beauty and how the society perceives them, their boyfriend or their near and dear ones, they'll be teased. So that is one issue that we need to deal. That's why we should have a more discussion on this question of what do we mean by beauty. No? So if you this second one is that so many people can see during the day, but blindness, we can't use that word now, it is objective. But those who are unable to see at night, which is very, very common among marginalized sections. No? At night they can't see. So for that also we need to have campaign which is across the states or everywhere. You see that there are many people who can't see at night, and so many accidents also take place, the fall and all because of that. So what has to be the intervention strategy for that? And these are the people who are even, it is across the age group also. There are children, there are adolescents, there are youth, and there are elderly people who can't see during, who have no vision at night. During the day, they can. Yeah, the two issues.
Yeah, ma'am. Thanks so much. Can you please summarize the first thing that you have told? Very
First
short
thing
way.
is that how the whole question of the wearing of a specs linked with the concept of beauty, no? That it reduces your charm or a personal appeal if you wear this thing. Or the youngsters also think they look much older if they wear specs.
Yeah, ma'am. Thank you so much. Can I add on or?
Right.
Yeah, thank you so much. On the first thing that you have told, yes, that is correct what you say. But if you see in the modern era, I'm working in a retail private corporation as a consultant and retail optometrist. I have seen people coming up buying glasses even they don't have specs. So that's been changing now. There is a transformative change because movie stars are using specs. Now the laptop things are coming. Now so many optical retailers are advertising. You should wear glasses. You wear laptop and all those things. So now people are wearing glasses. So now the thing is, now maybe a little bit transformation happened in accepting the glasses as a fashion, not like a medical tool. Now they're okay to wear glasses. Yeah, yeah. So now the fashion thing has come up, but the thing is, there are two things. If are you wearing for fashion or are you wearing for something that you need? Because they don't want to wear with power. If you, so that'll be very thick. I don't want to wear it. Just give me a thing I can manage. That's first thing. Yeah, we have to look upon it. The second thing, what you have told the night, the thing people cannot see in the evening. So if you see, maybe when we were studying, we saw the vitamin A deficiency. So this will come in nutritional background deficiency. If you eat good, your vision will be better. That is one area. But if it's in other area, you eat good, you play good, whatever you do, still your vision will be problem. You would have seen people wearing thick glasses. So that is not related to your nutrition. That is related to your gene. If your father has -4, you have no way to stop your specs. So you will never know father had specs or not. If you go to low income situations, they always think, oh, this is how the problem. Father could see only the 1 meter. They also think that is very normal to the kids. So So yeah, so this can be done only when you screen and tell them what this clear vision seems like. And we have another challenge. If you're not correcting the vision at the age of 13 or 14, brain will not accept the stimuli after 13 to 14 age, because the eye develops, that stops 14 age. Then you cannot correct. I become lazy. It never has accepted any spectacles. Yeah, ma'am. Thank you so much. I appreciate it. Yeah, I will.
But there have been cases of students who have reported that the engagement got cancelled because they were wearing specs. No? So that also, in the marriage market also, if you're wearing specs, then
Correct.
so these are the wrong conception.
Correct.
I think we need to work on. So even the
Sure.
Thank you.
Sure. Sure, ma'am. Thanks so much.
Now, so, number 7, no, Gauri. Gauri ji, are you there?
Thank you, ma'am. Yeah, I would like to invite Gauriji to present her presentation.
Yeah.
Gauriji.
She's there. Please. Need to unmute me.
Gauriji, you are the next presenter.
Can we move ahead?
Yeah, Abhay
Yes,
ji,
yes, yes.
would you like
Abhay
to?
ji. Abhay ji, are you there?
Yes, yes. Am I audible? Am I audible, sir?
Yes, yes, yes. Yes, yes, yes. You are audible.
Yeah, just a second. I've shared my PowerPoint presentation on the given email. Can you please check?
Yes, please give us 2 seconds. Is the screen visible?
Yes. Yeah. Mr. Abhay, you'll have to unmute yourself.
Yes, may I begin, ma'am, with your kind permission?
Yes, yes, please go ahead.
Hello, good afternoon, everyone. I'm Abhay Trivedi, a fifth year BLLB honors student at Maharashtra National Law University, Nagpur. And with the advice and guidance of everyone at the IMPRI, I've done this article titled as Governing Digital Finance, UPI and the Transformation of Banking Habits in Urban and Semi-Urban Areas. Now, my study looks at how digital finance, especially UPI, Unified Payment Interface, is changing the day-to-day habits of people in India, and how this change is different in semi-urban and urban spaces. That has been my research. Now, I begin by noting that at the outset, India's culture of finances has gone through 3 clear phases. First is paper-based banking dominated by intermediaries, then post-liberalization services like ATMs and cards, and finally the digital push triggered by demonetization and digital India. Now, UPI sits at this third stage at the heart of this digital phase, and it has made payments instant, almost cost-free till now, unless and until a new policy is rolled out, and very seamless, which has replaced cash for a large number of population. Coming to the, ma'am, can you please change the slide? Now, coming to the research approach, instead of using the secondary numbers, I have relied on the qualitative research analysis. And there have been questionnaires and semi-structured interviews in 4 locations around Nagpur. Now, one more slide, ma'am. Next slide. The 4 places are Sitabardi, Dharampet as the urban areas, and Hingna and Kuradi villages as semi-urban spaces. Now, my research objective has been to study the adoption growth of UPI at the semi-urban places, the 2 villages I have explored and researched, and 2 places, the urban areas. Now, to understand the behavioral change the people have undergone after the UPI has been at the heart of this third phase of finances, and identify the key challenges. Can you please move on to the next slide, ma'am? Yes, in this slide, the research is the urban areas, Dharampet and Sitabardi are there. In semi-urban areas, Hingna and Koradi. Now, it is to be noted that the urban areas have high financial exposure, and in Hingna and Koradi, the adoption of UPI is still uneven. And for the same, the research findings will help us to reach the outcome. I've intentionally compared 2 generations to understand the usage of UPI. The first set of sample is people above 50 who represent traditional cash savvy users trying to adjust. And the another set is of students about 20, which is from my university and from my campus, who are digital natives and who are in the Gen Z generation, trying to uh, trying to avoid cash and use UPI mostly for all their transactions. Now, the goal was not only to see how much UPI is used, but also why people do or do not trust it, and what makes them switch from cash and what blocks them. The key findings, there are 3 patterns which stood out. First is UPI is now the default in urban youth behavior. The first set of sample, the students below 20 and around 20, they report using UPI several times a day for everything: food, tuition, then rent, e-commerce, even for canteen purchases, even basic commutation. The reasons are convenience, speed, and the absence of physical risk they carry with the cash. And the cash is carried only as a backup. This is the primary finding with the age of 20. Ma'am, can you please move to the next slide? And the second pattern is which stood out was that semi-urban adoption of UPI is rising in the semi-urban areas, but the barriers are not only symbolic, they are material. Now, the reasons, as per the findings, are that people are not resisting technology out of their mindset alone. They hesitate because for various reasons. First is internet is unstable, awareness is low, and the trust collapses easily after one fraud story or one failed transaction is heard. And these 3 reasons are the primary reasons given by the people that they hesitate going UPI. Now, local markets in Higna and Koradi still show pockets where cash is the norm because the seller is not digitally confident. Now, this was the second pattern. The third pattern, which is interesting, is that the policy has been a powerful driver. The policy of UPI, the UPI initiated policy by the government, but it has not made the system future ready. I'm reiterating this because government has pushed Digital India as the policy, and multiple incentives and literacy campaigns have been going around, which clearly accelerated adoption in the urban areas. But when we move beyond UPI into blockchain, cryptocurrencies, and VDAs, virtual digital assets, there are certain regulatory uncertainty, which has become a huge hurdle. For example, coming to the current VDA tax regime, it is 30% tax plus 1% TDS, which has pushed legitimate users away from the regulated space. And there is a lot of gray area there. So while India in the urban areas leads the payment layer in UPI and other digital transaction mode, including blockchain, cryptocurrency, and VDL, it is slowing down the innovation layer furthermore. Can you please move on to the next two slides, ma'am? Yes. Now there are policy recommendations which are emerging from my research, and the first one is that there has to be regulatory clarity on emerging tech, because furthermore there have to be safeguards pertaining to safeguard as well as clarity on the gray areas such as VDAs and blockchain. And instead of an ambiguity or punitive posture on these mode of transactions, we need a structured, risk-aware, but enabling framework so that the innovation stays within the regulated space. Now, there has to be targeted digital literacy and trust building for semi-urban users, because adoption will not grow by apps alone. We increase the number of apps for UPI, for the online payments, Phone Pay, Paytm, Google Pay. However, the adoption of UPI will not grow by the apps alone itself. We need hand holding, we need grievance redressal, and especially the most emphasis should be on the fraud prevention education. Third is we need infrastructure reliability as a precondition to inclusion. Now, for UPI to be truly universal, connectivity in semi-urban zones must be treated as public infrastructure and not a private luxury. So this is the case for policy recommendations in the financial sector, in the digital economy. Can you please move to the next slide, ma'am? To conclude it in brief, UPI is not just a payment tool, it is a behavioral reform in how Indians think about money. But the transformation has been uneven. If India wants a financial ecosystem that is not only digital but also secure, fair, and future ready, averse from the financial frauds, then policymaking must now move from expansion to stabilization. And from just the adoption, just the emphasis on digital India and the adoption of UPI and other modes of transaction, to trust building, and from digital payments to digital governance of finance, because governance has now become a new hot topic, how to deal with the financial frauds and the entire process. So this was my presentation on the research topic. Thank you, ma'am.
For
Ma'am,
Thank
you're
you,
muted.
Evaji, for your
Yeah.
insightful.
Yeah, so thank you, Aditya, for bringing out this importance of digital. This thing, I am a digitally challenged person, so I don't use digital. But I think we need to have a differential approach, because senior citizens who are not tech savvy, and I remember during Cohort, COVID, my bank would not allow me to do the digital checkout because so many frauds had taken place. So this is the genuine problem. It is not one story which we read in the newspaper. So many stories don't even reach the media, and people suffer silently. So I think for different age code, what kind of hand holding can the banks, financial institutions, and the state do to see to it that their transactions are not they don't suffer, no? Because now even if you go to bank, if you don't use digital technology, you are treated as a nuisance by the bank staff. No? So that is the kind of prejudice they have about those who are digitally challenged or those who can't negotiate digital technology so well. That is one. The second aspect is about the IT Act. What kind of safeguards IT Act? I think you should include in your this thing and the Ministry of IT's directive, and the uh, overall functioning of the cyber cells. Because anytime we face problem, we approach the cyber cell. Most of the time, that your complaints don't even get uploaded. No? Maybe because of too much of traffic or this. So I think they need to have decentralization of the facilities of cyber cell, because so many different types of fraud. It's not only the economic transaction, but other things also happen, no? For impersonating. So these three are my suggestions, which you should include in your essay. Yeah.
Yeah, thank you very much, ma'am. I will also include the suggestion as was received on the email for my
Yes,
extended abstract and inculcate these three changes. Thank you very much, ma'am, for the brief.
Especially for different age group, what kind of hand holding should be done by the financial institutions as well as the state, the safeguards from the state. Thanks.
Yes, ma'am.
Yeah.
Thank you, ma'am.
Very
Thank
good.
you very much.
Ma'am. I would like to invite Tanisha Upadhyay ji. It is a recorded video, so now I will like to request the team to kindly play the recorded video.
Omka, before Tanisha ji, Tuba is presenting. So Tuba, then Tanisha.
All right. All right. Tuba ji, you can go ahead.
Good afternoon, all. I'm Tuba, and the topic of my presentation is Missing from the Map Children's Everyday Life, Play, and Spatial Negotiation in Delhi E-Waste Hub, Selampur. So, I'm a research scholar in Jawaharlal Nehru University, New Delhi. So, what I wanted to search, so Selampur is a settlement. It's in the northeast part of the Delhi, and it's a kind of resettlement colony. So, there some of the houses are regulated, and then some are unregulated. So I wanted to understand how and where children play and what are their everyday negotiation in that space. So talking about background and these things, so Selampur is heterogeneous set of neighborhood with distinctive history of habitation and social division of labor. Moreover, it's largely concentrated by Muslim population, whereas Hindus remain concentrated and in only Hindus only streets. The settlement is mixed, but there are different streets for Hindus and Muslims. Now it's a densely populated area with a large amount of yeah, so it's densely populated area with large amount of unsafe building stock and unsafe structure. So the area is highly vulnerable to fire hazards and floods. So since it is in the floodplain of Yamuna, and so the area is very kind of it's very dirty. So it has a large incidence of diarrheal disease and dengue. And the 30% of the building have been built during the last 10 years. So increasing the built up density and decreasing the open space. Moreover, there is no defined area for dumping, as we'll see next. So I took the outdoor play as an entry point to understand children's everyday negotiation with the space. So now talking about outdoor play, it's essential for children's physical, mental, and social development. However, the idea of what constitutes childhood and who are children has temporal dimension. For example, if we will see historically, then Middle Ages children were not considered different from adults, but after Enlightenment and then modern construction of childhood, it was understood that children should be in the separate institution of security, consumption, and education. And so the daily life of children are fundamentally special, and that they learn through using the resources, norms, and values of social spaces they live in. For example, playground. So, and then children's play is influenced by cultural assumption and practices concerning how play is seen and evaluated in the society. So there is a role of the composition of playground as well as cultural norms relating to the expressing emotions. Then we had two happenings which were very important when we talk about children and then their rights. First is United Nations Convention on Right of Child. So it was the first international convention, and its Article 3, 12, and 15 are very important, which they talk about that children have right to be heard on the matter concerning them, and then they have right to express their opinion. And then we had new sociological studies of childhood in 1980s, which 1980s and 1990s, which first acknowledged the children's agency and the children, and then children are social actors. And so the rationale of the study are the age is one of the element on which people are categorized, and so their abilities. However, in comparison to social differences like gender and ethnicity, this identity is often underexplored. Moreover, in the setting, there has been no study to understand the lack of play spaces and children's and caregiver parents on view of children. And then my research question were, how do children negotiate and reimagine play within the constant and risky spatial condition of dense and informal settlements? Then in what ways do gender norms and parental perceptions shape children's access to and use of play spaces? Then how do material conditions such as density, pollution, and infrastructural neglect affect the spatial culture of play? So the methodology I used was, my research design is qualitative and exploratory, since it tends to understand the views of children first of all, and then their parents. And the respondent group children are primary respondent between age 6 to 14, which correspond with the census and then surveys of India. And then their parents and guardian were secondary respondent. So the sample size was 16. I interviewed 8 boys and 8 girls between 8 to 14 years of age, and then there were 6 mothers and 2 fathers. So the method of data collection was direct observation, then semi-structured interview with children and caregiver, then transit walk with children, which were boys, since girls were not allowed to move beyond particular streets. And for data analysis, I used thematic analysis guided by grounded theory logic. So grounded theory says that when the researcher goes into the field, they have very preconceived notion of the things, and then when we interview people and then we see the field, then can, uh, then themes emerge out of the narratives respondents. So there were 6 themes which emerged from the fieldwork. So the first was spatial inequality and constant childhood. So all of the things have been represented here through photographs. So in the first photo, we can see that there are very dense colonies here. So there is no space between the houses. And in the second picture, we see the children are playing in the streets. So they don't have dedicated play spaces. They play here, and whenever the vehicles come, then they have to give space to the vehicle, and in that process they are hurt. And then in the fourth and fifth photos, the children are playing in the street. So there's very narrow street, just one can this bike or something can move, and then children they make their own spaces. And then the second was gendered access to spaces. Although the spaces were constant, but within that women this girl children, they had more constant space. So in the first images, we see that the boys have kind of they go outside, and in the second there was a park of municipal corporation of Delhi. So these boys children, they were playing, and when we asked them, they said that no, girls are not allowed. So what girls did, that they had their own adopting mechanism, and then these girls were just the streets were very kind of dark, very narrow, but the girls used to play there only. And then the third was ecology of risk and environmental neglect. So although these children played on street, they had less spaces. However, since there was no dumping site and no regulation, so all the spaces where this filled with dump. In the first 3 images, we see that how these roads and all, and then in the fifth image, we see there's a drain, and then the garbages and also people told that at the time of rainy season, all these garbages come into the road, so which further restricts children's mobility. But the boys said that they can adopt this thing, and they can even play in the mud and all, but the girl says that this further restrict their mobility. So this thing, and then it also is the cause of dengue and malaria. And the fourth theme is moral and social control over play. So it's been argued in childhood literature that play and play spaces is not only about social, this physical infrastructure, but also how it is viewed from the adult's perspective. So when I interviewed parents and caregivers, so none of them told that play is good for children. So they said that it's children should do study and it's just waste of time. And then the people in the colony, like in the image, this lady shows, so she was very kind of scolding the children, and then she said that these children are very ill mannered. So since they don't have, they say they play in street, so they kind of disharmonize the environments, they shout and all, so it's not good. And then in the first image, we see that the whatever the open space it has been encroached by religious institutions. So there were temples and all. And in the third image, there was one open space, but it again shifted to adult priorities, and it was used for community gathering and not wedding functions. And then fifth theme was socio-religious segregation. So like when we moved into the street, we found that every house had a separate flag. So we kind of inquired, but we couldn't get the answer. But the flag were kind of green and orange, so one could get a sense what does it depict. And when we further interviewed, we came to know that this space was 2-3 years it was fine, but after since 2-3 years there had been a communal disharmony, and there had been a kind of murder and all these things. So people are very much adamant. They don't want to mingle their children with the children of other so-called other communities. So, and then this has a negative impact because it led to kind of competition on whatever the limited open space they have. And then further, for children and especially girls, they said that now they have further their ways of socializing has further been neglected. And then the sixth was everyday agency and adaptation. So it's then childhood scholar argue that when children don't get space to play, then they have their own micro strategies of joy. So in the three pictures, one could see that these children, in the first picture, children were playing, and I think they had visiting card or something. So, and then in second, these girls are sitting with the kitten, and in third, the children are sitting, it was some cement or something. So these, since they don't have spaces, they don't have equipment, they don't have infrastructure, anything, so they are creating their own strategy, and then they kind of their own joy. And so the after these things, my policy recommendations would be there should be child sensitive urban design guidelines, and then there should be a reclamation of encroached spaces, and then improved waste and drainage management. Then there should be school community partnership, since there were a few play spaces which were under the control of the school, but they were limited within the school hour. So that if school could kind of uh, do partnership with the community, so whatever the spaces they have for the children, they would be they could be made more better. Yeah, thank you.
Thank you, Subhaji. I will invite Vibhuti ma'am for her comments and remarks before moving to next presentation.
So, Subhaji, yours is you have got so many important nuances from the ground level reality, and also your pictures are also very evocative. What I wanted to say was that you should also talk about the local self-government bodies, the municipal administration, as well as the corporators. What is their duty? Because see, each corporator is given a area development fund. How are they utilizing it? Because wherever the corporators care for the community, they are using area development fund. And now for the big cities like Bombay and Delhi, it is like sometimes 1 crore per corporator. So they use it for creating playground, reading rooms, and then cultural events they sponsor. So a lot of, as per the demand of the community, they are creating. So I think we should also talk about how is the area development fund of that ward has been utilized by the elected representatives. That is a one aspect. And second one, that when you talk about the space being occupied by the religious institutions and all, it is a very sensitive topic. It is everywhere, all over. So just don't write temple or mosque. Let's say that the religious, it has been used for religious purpose, and the space has been occupied for that. And children don't get to use it. This thing. And third one is that are the schools in the vicinity allowing children to use the playground after the office, after the school hours? No, because in many areas, like in my school in Baroda, children could use those playgrounds of the school even after the school closed down. No? So even in the evening when they return back to their homes, they could use it. So is it possible to deprivatize the spaces of the school? If they're a private school or public school, are they allowing children to use these spaces? And your recommendations are most definitely, I think, all four recommendations are right. But I think the budget of the corporation and how the ward officers as well as elected the corporators are used for area development. There must be, because it is a felt need, it comes out from your interview. The children's playground is a felt need, and have they given serious thought to it?
Yes, ma'am. When I inquired about the school spaces, then they said that there, the girls, like there was a division of time, but a temporal division about. Then they said that the girls use school from 8 to this afternoon. Then after that, boys use. So till the evening, the school spaces are occupied. Then after that, some of the, like in the area there were more government schools. So then we asked. Then some of the children said that the primary schools, they are open all time of the day. But since there is no light and also till evening, there is this school hour. Then after the sunset, then they don't have this thing, lights and all, street lights. So although the space is there, but it can't be used in that way.
Yeah. And the corporators and administration, uh, how have they used the budget? That I think you can still add this person.
Okay,
What
ma'am,
have they done with their area development fund for its use? Because they use it for building crematorium, reading spaces, community reading, like in Mumbai we have, where the poor children who can't read or study at home, they go to the community place, which is community place, with newspapers and table and chair, and they study it. So those kind of things.
Yes, ma'am. Thank you.
Priya, thank you very much.
Thank you, ma'am.
Priyanka, how many are there? Now, how many are left?
Ma'am, we have one live presenter and 2 recorded videos.
So can we resume at 3 o'clock? I need to serve it. Even if you give me half an hour break, that is fine. Yeah.
Works, ma'am.
Hello.
Yes, ma'am. We can take, ma'am, one presentation. It's a short by one live. Then only 2 recorded will be remaining.
That I think you can send me by
Yeah, ma'am. You can
email.
give your feedback online also. So we can have one presentation, ma'am.
Yeah. Okay.
Okay, thank you, ma'am. I would like to invite Savitri Sanyalji to begin with her presentation. Savitri ji.
Am I audible?
Yes, ma'am, you are audible.
Okay, am I visible?
Yes.
All right. So thank you so much for this opportunity. It really meant a lot. So I have been a social worker for the last 10 years, and I have been working very closely with communities. So this program gave me an opportunity to dive in even deeper as a part of the work that I do. So Resilient Hearts, Empowered Minds talks about how we can create spaces where we can invite adolescent girls to come out and have access more to their choices, to their rights, to their bodies, in terms of understanding their emotions, so that they can always cultivate a better community, a bigger community. The gaps that we found on the ground was 2 out of every 3 children have experienced physical abuse of some sort, and 50% have had emotional abuse or sexual abuse of some sort, and that has been clearly shared by the Ministry of Women and Child Development report. Only less than almost 45%, so it's like even less than 50%, less than half of the young women, they know the use of condoms, that condoms can prevent HIV, and that has also been a very serious alert. After the COVID, what happened was more than 1 million girls have not returned to school. That was the entire, like, the global survey that came up, and that information has also been very crucial for us, because we have seen how even in India so many girls have got lost in terms of early marriage, in terms of daily wage labor based work, in different types of things other than coming back to the schools. There are 2 very important policies already in place that we can see: the school health wellness program and the Rashtriya Kishore Swasthya Karyakram. But then the challenge exists with implementation of these programs and proper monitoring of them. So what the response has been made is that from my end, and the work that has been done till date with the community educators, the school administration level people, and of course the parents, a trauma-informed socio-emotional learning, age-appropriate based, comprehensive sexuality-based education to create safer classrooms proper engagement and create a space where the girls find it possible that, yes, I need some help. I can have that question and I can create a space where me and my friends in a class can reach up to this teacher in a proper setup to ask questions. So that is one of the biggest responses. The second response was the program that is already in place, and I have already, I will show that in our, I think second last slide or last slide, about how the program that is already in place, the school health and wellness program, how that program with the help of ambassadors, like wellness ambassadors, can make a huge impact even in the schools as well as in the community after engaging the stakeholders who are the community educators, social workers, and parents. So the insights mainly revolve around the silence and stigma around the bodies that exist, and how boundaries, consent, and safety can be addressed through very small creative-based, art-based exploration through breath, movement, journaling, and somatic practices. Soma means the body, so somatic practices. Next slide, please. Okay, our objective, as we can see, were mostly about creating the space that we have created so far. So learning spaces, if there can be curiosity, there could be spaces where a lot of safety, a lot of non-judgmental based approach exists, then the place becomes very safe for the children. Body literacy and boundaries to improve the consent based and have more clarity, have more better understanding about what my boundary looks like, how the boundary of my friends they look like. And then of course coming to the educators part, because they are one of the biggest important stakeholders in the entire program. So community educators, how trauma informed facilitation could be huge. So when we think about trauma, people generally think that trauma is something that has happened. So it's an event, but basically that is not an event. Trauma is what happens after the event. Trauma is how we are looking at the event being triggered in our own bodies, or something being activated in my own body, but because a child or an adolescent, they do not have the understanding of what is happening in my body, there is a very less understanding of emotions. The entire thing gets projected in a very different manner, and children are reported in the schools to be absent, to be ill-mannered, to be naughty, to be uncivilized, and all those type of adjectives. And of course, engaging the parents have been so important. So the theory of change was always, because we know when I worked with the kids, when I'm still working with the children, I have seen how they are arriving at the space in a very dysregulated manner, and it's so easy for us as facilitators, as educators, and as teachers to label them immediately, to label how the child's brain is. But here what we have started is that regulation first, so that we can start with a space where there is a lot of breathing activities, lot of movement based activities, lot of storytelling and art based and creative activities. And even if nothing is there, we can just sit with the child and say, hey, how has your week been? How are you? How are things at place? And giving that space for the child to understand, I can share it, I can share my things here. Next to the consent part, where we have understood and we have discussed what does consent looks like what is consent, because we come from a setup where not a lot about consent is taught, not a lot about boundaries is taught, of course, because of the way we stay. Because when I'm talking about a community, when I'm talking about a society, that there are the biggest chunk of the society falls under a very vulnerable, marginalized socioeconomic profile. So there is only a 8 by 10 feet of room where the entire families are staying there. So when we are talking about consent, that doesn't exist. But how about we create a space, where they even if they cannot take it home, they can try to understand that this could be a space where I can practice my consent. This could be a space where I can ask for permission or give permission in return. And then comes, of course, With a lot of compassion comes a lot of wisdom, and again vice versa, with a lot of wisdom comes a lot of compassion. So how we can set up a safe environment, learning and voicing out the needs, of course, and reinforcing as a part of engaging the families and the education based supporters. Next slide, please. So when we are talking about the methodology and the ethics, it has been a very interesting study so far, because it has been mixed study. There have been qualitative questions, of course, because to understand the behavioral patterns, especially after attending those sessions. Qualitative studies, something that we have taken in consideration, I have taken in consideration, but there has also been quantitative study to understand, there are Likert scales, we will show that. There are Likert scales to understand was it something that we practiced earlier, or was it something that's completely new? So there are field notes, reflection logs, there are conversations, ethics, of course, consent is taken. There is always a space of permission. There are children, we have always invited this space where I have asked the children, is it okay if I take the photograph? If it's not, we have taken the consent, written consent from the parents to understand that if it's okay to take the consent, to have their photographs or videos. And of course, there have been reportings for disclosures, and we have collaborated with the community workers, we have collaborated with the NGO workers. The school president has been extremely supportive in arranging a space for us, the government school president. So that is how we have moved ahead. Moving ahead, next slide, please. So the girls have been mostly of 13 to 16. However, with the work that I have done so far, I will add that in the abstract also. I'm yet to submit that. Very sorry about the delay. So there are children who have been extremely interested and they have joined the setting. So we have had girls from 13 to 16, but we also have girls who are 12 years or 11 years of age. The setting has been a community space just beside the government school, and like facilitation has been supported. I was there, of course, as the primary role, as the primary facilitator. Besides that, there have been teachers, there have been supporters, community people. A lot of materials have gone into this work so far, because it's a very creative arts-based explorations, and we have completed 10 sessions so far. It's mostly 60 to 75 minutes, so it's like 1 hour, 1.5 hour sessions that we have. Next slide. Okay, so basically when we are looking at the session design, we are looking at two things. Number one is, of course, like I said, regulating the body. So when we are talking about regulating the body, we are talking about the brains, we are talking about neuroscience. So to establish neuroscience, we cannot really go into a cognitive level. So when we are talking about a cognitive level, it means a lot of discussion, arguments, understanding. But because this age is not like they hear lectures all the time, and that is not something that we really wanted to establish in these sessions. We started with the body, we started with the kinesthetic approach, which means exploring with what is happening in the body. How can we calm ourselves down? What are the breathing techniques that I can do? What are the types of arts-based exploration? How can I move my body to feel that, okay, how was my energy before and how is it now? And then slowing down, always taking a pause. And to pause, we mean, of course, the breathing exercises, calming down exercises. And they're like any kind of trauma response has these modes, the freeze, flight, fight modes. There is also a fawn mode, which is better known as the people pleasing mode. So all these type of modes that have been reflected in the study so far. I will definitely, when submit the bigger study, it will have all these details in a very detailed manner, just being mindful of the time and keeping it short. Next. Okay, yes. So here, before just to add from the first design, that we always meant that when we are talking about the body, there is no right or wrong feelings. There are no right or wrong emotions. And when I talk about no right or wrong emotions, we are talking about no good or bad emotions. So whenever there is a emotion, the understanding of emotion is so vague, is so missing from this age group. So whenever we are talking about emotion, whenever we are doing an activity to address with emotion, why is it coming, what are the emotions, what happens to my body, what happens to my mood when there is an emotion. So that comes under the body literacy. And when there is a body literacy part, we are inculcating body-based understanding, mind-based understanding. So we are bringing both the connection on the same plane, and we are doing it with creative arts. We are doing it with expressive arts-based modalities, where movement, journaling, art making, especially art making, plays a huge role. Storytelling, working with puppets, play a huge role. Consent and boundaries have been very important for this study, because is it okay with me when something bad is happening? Firstly, how will I know that this is bad? If there is something that is happening with me, it could be a family member, it could be a trusted adult. How do I raise my voice? So this has been again one of the very important, crucial parts of what we have done so far. And how to raise my voice, how do I understand who are the people I can reach out to? So creating a support system after my boundaries have been violated of some nature, how to reach out to my safe pathways have also been very important for this study. Moving ahead. Yes, so I'll go very quickly. Everybody can read through. I won't be repeating the points. As we can see, the quantitative questions have actually again been aligned with the 4 parts, 4 major pillars, and this has been done on a Likert scale, and there are yes or no, just to understand how the approach, how the entire picture of where am I, how safe I am feeling in my body, what is my socio-emotional condition, and how achievable or how approachable are my are the people around me to whom I can always reach out when there is a crisis. So these are the questions that have been explored as a part of the quantitative study with the children. Next slide, please. And these are the questions that have been explored with the parents and teachers. So how much comfortable are they, discussing emotions, consent, and body literacy? So there are times that, they are very comfortable, and there are times then that they are not very comfortable. What are the times that we have dealt in as a part of the qualitative study? And that's why I said that this has been a very important subject for qualitative study, because this project has not been very linear in understanding, to understand yes, no, 50%, 60%, 70%, because these are all things that are happening in the underlayer. And we are from a space, we are from a country where we are not equipped from our basic childhood to talk about our emotions, to talk about our mental health. And that's that, of course, the things are changing. I can see a lot of changes happening all across the country right now, and that is so helpful. That is so helpful. So that is, of course, another thing. And the home and school practices. So when we are doing something in a space, when we are doing something in our own space, community space, if that is not being taken to the home, in the further community awareness, that makes no change. So only changes that are happening in the field, only changes that are happening in the community space will only make an impact, will only make an effect when the changes are happening as well as in their own homes. So that is why we have also spoken with the parents, like how approachable they feel the children are about raising questions. Are they looking at things with a little bit of curiosity? Are they trying to recognize whatever is happening in the body? So things like that. Moving ahead. Next slide, please. This is again the FGDs and the qualitative prompts that we have used to understand what does the regulations look like, what about the body literacy, how does my menstrual, how okay I am with my menstrual pattern, am I too cautious, was I too cautious, how am I doing it now, how am I looking at it? So of course there are beautiful resources across our country. So many young entrepreneurs have done so many things. There is Menstrupedia, there is Tarshi, there is Pratisandhi Foundation. So a lot of work is also happening, and all the resources that I have used have been, of course, a part of this work. I am also a dance movement therapy practitioner. So as a part of my work, I have taken support from the dance movement therapy based curriculum, the fantastic work done by Simtai, Tripura Kashyap, Shohini Chakraborty by Kolkata Sanved, and all of these mentors. There is Kathy Malchiodi, one of the biggest expressive arts therapists and arts therapy educator from the States. And I had the privilege and the opportunity to learn from all of these people, and I have tried to make use of all of these resources in this community work. Moving ahead. So again, the qualitative that we have understood from the parents, from the teacher stakeholders. Did you try grounding with your child? Was there a moment when your child went back home and they taught you something new? How do you look at it? What do you think about it? So things like that. This project really showed me that part where if good stakeholders, like the way we do the stakeholders analysis, high influence and high power, right? The stakeholders with high influence and high power, if they are very kind, in this project I really got the support of the president of one of the very oldest schools in West Bengal, Calcutta, and he was so kind, he was so generous to offer the community space and to be there to share his inputs. There are very few less people who actually encourage work when it comes to mental health, and this work was actually encouraged by him. So very grateful. There has been the community educators that we have worked with. Proshanjit was one of our major community members who helped us to have access to these people, these communities, schools. There was Ansari, who has been extremely supportive in terms of arranging everything, helping me to design the plan. So very grateful to all the team members who have helped this journey so far. Moving ahead. So these are just tiny thoughts of what the children have said to understand the themes. There was a great amount of understanding that there is this thing that I can do, when I'm angry, maybe I could practice that. So those options, and telling no without shouting, without screaming, because can't blame the children. They see a lot of violence on a regular basis, be it bullying, be it domestic violence, be it my father today running away with my mother running away with my father, without my father with her boyfriend, my father running out with a different woman. So these are the things that a child. So when I see things like that, it becomes a part of who I am, and that is how the society starts labeling me. So how do I come out of these labels? How do I let go of certain labels? Besides this educational part, I have also taken a lot of understanding from Buddhism, from Islam, Sufism, and they have been so helpful for me to design this sessions, because they have taught me to look at it from an aspect of compassion, from an aspect of wisdom, and how everybody coming together can always vouch up for spaces of equity, of trauma informed care, where without asking a child what is wrong with you, we can ask, hey, what is present with you today? What happened to you? What do you want? What do you think is alive in you? What do you think are your plus points? What do you think are your strengths, are your resources? How can you turn your sadness to joy? So things like that. So those shifts, how to create a space with those shifts. So moving ahead. So of course, like as I said, these are again the tiny things that we have received from the parents and community educators. There were tiny shifts, like these were with tiny shifts. So even the first thing, say relief, she returned smiling, less irritable. So this was just a return smiling from the hospital. So the girl, she got a vaccine and she was absolutely totally not unwilling to go, and every time she visits the hospital, because she has a pass with the hospital, she stayed with the hospital for 1 month, long back, a couple of years back. And then when she was returning, she generally has this entire tantrum throwing out. But then with this process, with the breathing in, breathing out, okay, this is just a day, they are doing the job, the doctors. So looking at everything, what is happening in our lives with some sort of understanding that, let's not assume that, let's not think about that. How about this thing can also be possible? How about that is also a possibility? So working around with the maybes, maybe the doctor had a bad day, maybe my friend had a bad day, maybe the teacher had a bad day. So maybe something I did, maybe something was not perceived in a manner. So, those tiny shifts. Moving ahead. Yeah. So of course, the way forward, like as I say, that this is a group that I have been working with and I will be working with. So of course, safer learning spaces climate was observed. A lot of grounding rituals were taken up by the teachers that were extremely, like really gladdened my heart to see that even the teachers can do those things. Punitive responses decreased, which means punishments were replaced by, okay, how about you do 3 more sums now, and I could give you, 5 minutes of break, or maybe, we can have a story checking for 10 minutes. So things like that, like just replacing tiny things. Of course, the challenges, we all know, time pressure. We have exams in the school, we have festivals for which the schools remains closed, the community spaces remain blocked, so cannot really, we have to walk through it, cannot take them as real big challenges. There of course, this is what we started with. There is a lot of judgment happening in the session. So what if others judge me came up multiple times. Multiple session parent engagements were needed because the community I work with, very marginally placed. So whenever most of the parents, like one parent is present, the parent has to go for work. Or even if the extended partner, the grandmother is present, the main caregiver has to go for work, otherwise it's a hand to mouth situation. So that is something, our work cannot be just let go of. A day's work is so important. Yes. Yes, Sana, I'll do that. Thank you for sharing, and thank you for telling that. Yeah. So then the way forward, as we can see, we are going to deepen the consent, the boundary scripts. We are going to extend the parallel parent huddles, huddles as in working with the parents. We are going to train 8 to 10 minimum community educators as a part of the work, so that this work remains sustainable. Nothing, if is not sustainable, will be able to bring a change. Moving ahead. Next slide. Yeah. So just I think this is the second last slide. So we'll directly go into the monitoring and learning framework. As we can see, the outcomes have been, of course, measured through self-reports. We have measured the outcomes in terms of understanding from their observations, from their participation, their language, and how they are reacting to stress, how they are reacting to art-based expressions when that didn't go in their own way, or creative-based explorations when that didn't happen in the way they were thinking. So what to do when things I want are not met. Risk management, of course, we connected with the local counselors. We are very much in connect with Childline and the local police, of the local police station also, to understand, because sometimes there is a huge chance of elopement, girls getting, they elope with their partners, like who are also equally young. Because whenever there is an understanding that nobody understands me at home, let me find somebody who will outside my home, and that is when, they go into risky zones. So again, the policy, we are completely aligned with the NEP's 2020 socio-emotional outcomes and life skills. This project complements with school health and wellness programs, but what we are arguing here is that how to have a trauma-informed pedagogy inside the socio-emotional learning and the comprehensive sexuality education based curriculum. So how can we embed a trauma-informed pedagogy, which means being very open about it, and like the next thing that we are also working is the part of recommendations. I have not put that slide because that's a huge slide where I'll be putting it in the report, where we are talking about how we can actually, have programs for the educators, for the teachers to understand what is trauma-informed pedagogy, how does it look like, what is a curriculum, why should we do it with children. So things like that, and the program is completely again SDG linked, good health, gender equality, peace and justice, moving forward. So thank you so much. This has been the main way. The key takeaway has been that about regulation is the main crux. That is the first thing. Whatever condition the children are coming in, let's regulate. Let's take a breath. Let's say the name of a color. Let's say what we can see in front of our eyes. What is a memory that is coming up for me? Let's take one part of that memory that is important to me. So things like that, quick check-ins, and then of course practicing over perfection, letting go of that perfection part, and being with the flow and practicing about that. And of course community, whenever the intention is to have bigger communities, richer in terms of wisdom and compassion, we have to include communities as a part of the work that we do as facilitators, as teachers, as educators, social workers, social experts. And that is the main key takeaway. All have to be in a circle. We always used to sit in a circle, without any hierarchy, to understand how is it going for you, how can we go ahead together with that, because all of us, we are in this entire thing together. So thank you so much, ma'am. Thank you. Yeah.
So thank you, Savitri ji, for such a exhaustive presentation, and also with a lot of clarity about the concepts and also psychological tools that you have. My only two questions were, one about the POCSO. In case of child sexual abuse, there is a mandatory reporting, which is for doctors, counselors, school teachers, and all. So, how do you deal with that? And second one is the Juvenile Justice Act, which sees a boy, like even if the man or a boy is always seen as a, conflict in law with the law, no? That if there is a romantic inclination, a romantic relationship, boy is classified as the person in conflict with law, while the girl is seen as a child in need of protection and child in conflict with law. So these double standards we have in the Juvenile Justice Act also. So how do you see to it that criminal justice system to protect the interest of a boy when it is a consensual relationship? Because the girl side will always say that he cheated on his future, he kidnapped that child.
Yes, thank you so much, ma'am, for raising those two questions. I'll definitely, include these questions as a part of this study. The thing is that I really wanted to keep this two parts, but then something inside me also spoke about the punitive aspect of the POSCO law, because, when we are talking about justice, we have to have because through this pedagogy, we can have an understanding of restorative justice, how restorative justice looks like, where we bring in as a mediator the perpetrators, underquoted perpetrators, and the person as a victim, again underquoted, to understand what are the losses that have happened and how we can address those losses without hampering much, without, because something must have happened, and that's why, so yes, ma'am, thank you for that. I will definitely add them as a part of
Add these two things, yeah. Juvenile Justice, reflection on Juvenile Justice Act and the gender bias, and also the question of obsession. Thank you. Very
thank you, ma'am.
Thank you, ma'am. Thank you so much. We are grateful to all the fellows who presented their work today. It was truly a great learning experience, and we look forward to seeing your final research outcome. A special mention to Professor Vibhuti ma'am ji for patiently listening to each presentation and for sharing her invaluable feedback and remarks. Now, I would like to invite our chair to deliver the closing remarks.
Yeah, I think this course has been very, very rewarding both to the resource persons as well as the fellows, because fellows are also working professionals. They are very intensely involved in the work that they are doing. And that comes out in today's 11 topics. First of all, the choice of topic, the treatment of topic, for this essay. I think that itself shows that there is a lot of learnings, and uh, even in terms of policy, in terms of programs, in terms of intervention strategy, all the topics chosen by the fellows have been very, very crucial to bring the transformative change in our society. So I thank all the fellows for their commitment to the research and commitment to the work. They have taken it as a mission. And that is quite rare to find in today's times of where we publish and perish. They have put in really their heart and head into the project, and that's why I'm really very happy. We are also thankful to all the resource persons of these last 9 days who have also made a very studied presentation and shared their long drawn experiences and case studies with the participants. Without thanking every team, if we end the program, we thank the whole IMPRI team, especially Dr. Arjun Kumar, Dr. Sini Mokta, convener of this course, coordinators Priyanka, Nikki Sana Ansari, and the team, and all the moderators of the last 10 days, including today's moderator. With this, I think I give closing ceremony to be handled by Priyanka Nikki.
Thank you so much,
Thank you,
ma'am.
ma'am.
So, Omkar, you are doing the finale?
Ma'am, we are having now the recorded presentations to play. Ma'am, you can
How-
leave. Like we really
How
appreciate.
long are they? How long are they?
Ma'am, it's like 7-8 minutes each.
Okay, then go ahead. No problem. I'll stay.
Ma'am, you are staying?
Yes.
Okay. So, ma'am, we have also one by Gauri ji. She also willing to present now. So, Gauri ji, you can go next.
Yeah.
Hello, am I audible? Hello,
Yes, yes, Gauri, you are
am
on.
I audible?
Yes, yes, you are.
Okay.
Oh, Gauraji is here.
Can you see my screen?
Yes, yes, yes.
Are you guys able to see my screen?
Yeah, it's visible.
Okay,
Yes, yes,
thank you.
Gauri.
Okay. Just a second.
Can you present in the slideshow?
Sorry.
Just
It's
do
in
the
working
slideshow.
mode.
Sorry, you're not audible. You're not clearly audible.
Like, can you do in
It's in the
presentation mode? It's in working mode.
Okay. How should I do it? Slide
You can
control.
see in the right side,
I'm not able to find
down,
it.
down.
Bottom left where there is zoom. Can you see bottom left?
Yes.
Bottom left, yeah. There's this zoom icon. No.
No, this
Plus minus icon. Go to bottom left.
bottom left, yeah.
Yeah, go.
bottom right, bottom right.
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 Where you can say volume 100% written there. Can you
Yeah,
see
yeah.
that?
Yeah, just behind
And
that,
there is
the next icon. The next icon.
The next icon.
Yeah, on the screen only. The next icon. Just besides the minus sign.
Go
Okay.
left. Get
This
left,
one.
left.
Left?
Yeah,
Yeah.
it is.
Okay. Right. Thank you so much. Okay. Very good afternoon. The topic of my presentation is Invisible Hands, Women's Unpaid and Underpaid Labor. Yeah. How should I? Okay. So there are a few quotations that I have quoted from various works that have been done. The crisis of care is a crisis of capitalism itself. I've quoted this from Feminism for the 99%. Women are the substructure of all human labor, the unseen pulse of every production. Marx and Engels said this. Without the participation of women, the working class cannot liberate itself. Krupskaya, the woman worker from the woman worker, said this. So there is also this Garwali saying, which I incorporated in my study since I'm doing a regional study, which is I'm taking Dehradun as a microcosm. Je ghar kaaj kar di, tinu kamai nahi kar di, which means she who works at home is not seen as earning. Again, which captures the invisibilization of domestic labor. Again, considering household work as as not something that could be seen as valuable as paid work. Sorry. Now, the research question we have is, like, have you ever pondered how we seamlessly carry on our hectic lives? I'm going to be providing for I'm going to give a glossary of all the concepts that you'll readily witness throughout my study. But for that, I'll only skim through these concepts. So I will begin by asking the audience to consider how our daily lives, our meals, transport, work, continue seamlessly, yet much of the labor sustaining this flow is invisible. I will introduce Marx's base and superstructure in my study, showing how economic structures shape society and culture, and outline department 1 and 2, production of means of production versus consumer goods. Then I will also present a department 0, encompassing unpaid and underpaid labor, primarily performed by women, which sustains both the departments. Drawing on my research of Fulo, a lower class household worker, wakes at 4 a.m., manages her children, her household chores, and works at multiple homes without rest or institutional support. Now, Nagma, another migrant wage laborer, balances her paid work with household responsibility across multiple families. These examples make social reproduction tangible, showing how women's labor underpins household communities and the economy while remaining unacknowledged in policy and data. This approach Marxist theory directly to lived experiences of laborers and women in general from Dehradun, highlighting the structural centrality of women's work, especially for again lower class women. So I will just skim through the theoretical foundation. Marx's base and superstructure. You might be knowing about the triangle where base is the forces and relations of production which forms material economy, and they only shape the superstructure, which is the culture, the ideology, the politics, and the institutions. Department 1 and 2 is a theory given by Marx. Department 1, which is the production of means of production. Department 2 is the production of consumer goods. Now, introducing Department 0 and social reproduction. Department 0 is something I've named, which feminist scholars talk about. The unpaid and underpaid labor primarily performed by women that sustains all economic activity. Like, for example, I am able to present this because someone is working for me. My mother is working for me. The house help is working for my mother and for my family. And that's why we as people can go on and about our work, about our education. Or, for example, again, I'm sitting here and presenting this effectively to all of you. Now, social reproduction, again, household work, cooking, cleaning, childcare, elder care, agricultural labor, fuel, wood, and water collection, maintenance of daily life, ensuring workforce and sustenance. There's a special focus on lower class women in my study. Although my study is intersectional, it still focuses on lower class women. Because they face high workloads, migration-related precarity, little to no social or institutional support, minimal recognition. Their labor is foundational, yet invisible in policy and economic discourse. The central question again is, how does unpaid and underpaid women's labor in the Dehradun district underpin the economy of Uttarakhand, and how is it socially, culturally, and institutionally recognized or marginalized? The objectives of my study is, first, I want to know how women articulate, describe, or interpret their own work, the value of their own work, whether it is unpaid or whether it is underpaid, paid, whatever. Also, I want to know the social valuation, how people perceive their work, how society, employers, communities, family members, or anyone value or devalue their work. I want to examine policy inclusion and exclusion to assess how laws and programs such as the Equal Remunerations Act and Manrega acknowledges, remunerate, or overlook women's contributions with a focus on lower class women. Through my study, I want to show the economic base to frame women's unpaid, underpaid work as the foundational base of the same base and superstructure that I was talking about, of as the foundations of Uttarakhand's economy, and also to make visible the work that sustains households, communities. Now, I also want to inform collective strategies to explore how women's informal networks, collective action can enhance recognition, bargaining power, and policy advocacy to demand communal care and also socialized centers for children, elderly, and kitchen work even. These are the set objectives of my study. Conceptual foundations, again, the same. Marx and Engels talk about departments 1 and 2 produce means of production and consumption goods. Feminist theory adds department 0, the unpaid invisible labor of production. Krupskaya said in her The Woman Worker, to liberate women is to change the very fabric of social life, to build socialism in the kitchen, in the nursery, and in the mind. Methodology, participatory action research. Women act as co-researchers in cycles of reflection, deliberation, action. I'm using a qualitative method of studying. The in-depth interviews that I've taken so far are 9, and I am aiming to take 10 to 12 more interviews. I have had a word with an NGO in my town, and they have given me a date not before 25th. So my major stakeholders would be the people from the NGO, the women that are working from diverse social locations at the very NGO that I'm talking about. Also, the mode of this presentation, I am already blending direct quotations, poetic narration, and I will go on about narrating direct quotations from the research, from the interviews, theory, and regional cultural references. A data snapshot of Uttarakhand and the unpaid labor. According to an NHFS file, for Uttarakhand, female labor force participation remains substantially lower than male participation. In India, not only about like 22% of women are in labor force versus 75% of men. Also, women aged between 15 to 59 spend an average of over like 5 hours per day on unpaid work, while men only account to like 1.5 hours per day. Uttarakhand specific, a policy brief noted a declining female labor force participation rate in Uttarakhand. Theme 1. These are the interviews I have quoted from the interviews that I've taken so far, and I'll provide my insights on all of the quotations. The labor that breathes but is unseen, the first theme, between wage and wakefulness. One said, Fulo, lower class domestic worker, said, my husband takes lunch to work, my children eat midday meals at the government schools that they go to, but I survive on chai and biscuit, the ones offered by the houses I work for. Also, Nagma, a migrant wage laborer, said work does not end for a woman, it is perpetual. She talks about how, upon asking if she gets any time for herself, she says that yes, as she does not get any time to herself because she wakes up, she does her household chores, and she goes out for wage because she's a wage laborer at a site. She goes to the site, she works there, she comes back home, and she has to perform household chores again. So she only gets rest when it is late at night, and she gets to sleep, and then she wakes up early. And again, Fulo, the lower class domestic worker, she wakes up. She has to wake up at 4 a.m. every single day, and upon asking if she gets any time to herself, she says, or gets any leave or gets any holidays, she says that she does not get any holiday or any leaves per se, but she does get a leave or two when she's sick. Even the child at their home became a caretaker, her lullaby, someone else's rest, because Nagma has her husband's sister staying with them. So she looks after the 6 kids in the house. She's 12-year-old herself, and she has to look after the 6 kids when all of the family members are out for work. Monthly income, one of the wage laborers said that 9,000, domestic workers said that 9,000 for her. Her husband earns 15,000. They have to pay 6,000 as rent. No savings, no welfare support. When Fuller was a wage laborer, before she was a household worker, she received 10,000 and her husband used to receive 15,000. When I asked if she is okay with the wage gap, she said that she does not mind the wage gaps because men and women have different works, and men have to put in a lot of effort, a lot of more effort in comparison to women. Also, Nagma is still a wage laborer and she receives 500 while her husband receives 700 each day. Just a second. Theme 2, the men who see yet don't see, contradictions of recognition and devaluation. Women should stick to household work. If they go out, husbands feel insulted. One of the male wage laborers that I interviewed said this, that women should just stick to household work, the work that is at home, because men usually feel insulted when their wives go outside for work. And he also said that this makes the man disturbed because if the woman would not perform household work, the man has to perform it, and everyone will start talking about it. Also, of course, women's work is valuable. Also, the same man said, of course, women's work is valuable. They feed, they clean, they raise children. But men's work is more difficult. He sees her hands, not her hunger. He supports community creches and kitchens. He also supports the ideas of community creches and kitchens. It would be good for women for all. He said that community kitchens and creches would be something that would be good for everyone. He also supported the idea of paid maternity leave and paid leave for women wage laborers too. He also supported the idea, this was something that he also supported the idea of paid household work. And he felt weird that women do not receive paid household work. This illustrates gendered ideology in lower class contexts. The urban mirage, single and corporate choice, exhaustion and invisible burden. I feel overwhelmed and emotionally drained almost 24/7. So this is a corporate lawyer, a very good, a very like high class corporate lawyer. She earns a lot. And upon asking if she gets time to herself or if she's emotionally drained, she says that I feel overwhelmed and emotionally drained almost 24/7. People think I'm not that busy since I don't have a family to look after, because I asked them if they are people's perceptions change for single women, single working women. So she said that people undermine her availability based on the fact that she does not have any children or any family to look after. There is this choice of performing household work, which is not seen amongst lower class women. On weekends, I prefer lazing around. Although she's almost always packed with work, she could also have a day or two during the weekends for herself, which she prefers, where she prefers going outside or, lazing around, as she said. So there is this choice of performing household work. And she also goes on to say that she does not like household work. She does not like to do household work. She does not also have any time to do the household work since she's almost always working. She welcomes community care centers. She says that it is a very good initiative. She feels that it is very good, but the barrier which comes is the class attitudes, because people might get averse to the idea of sending their elderly or even their children to community centers where there will be people from all classes and sections of society. So yes, there was this intersection of privileged labor and alienation. And also this class attitude was a barrier to the community kitchens, to the community care centers and all. From household to commune, another theme, collectivizing care, redistributing labor. Across participants, I could see positive views of the community-run centers, care centers, and communal kitchens. It would ease work for everyone. Chotelal, a meal wage laborer, said that yeah, it would be a good idea. It would ease work for everyone if even women are going out for work and men are going out for work, then it would be easier for them uh, to have their children look after, have them being looked after, and also to have meals prepared for them, and also have someone to look after their elderlies. Child and elder care is somewhat something that women at workplace have to manage a lot. A great initiative, a corporate lawyer, the same corporate lawyer that I was talking about. She also mentioned a colleague who is married and who always cribs about. She quoted that she always cribs about her family and how she has to always prepare food before leaving for her corporate job. She has to prepare food for her old in-laws, and she has to come home and then prepare food again, which leaves her no time for herself or to have some rest. The commune frightens those who've never shared. Now, there are class attitudes, social stigma, which is something that is a major barrier in this collectivized care and redistributing labor initiative. Sorry. Towards a people's department, from the base to the commons, revolution begins not in the factories but in the kitchens, where a woman refuses to serve and starts to organize. This is inspired by Krupskaya. And yes, this was my presentation. Thank you, IMPRI. Thank you so much for giving me the opportunity to present myself here. And yes, I would love to have your insights on this.
Yes. Excellent work, Gauriji. Very, very comprehensive, conceptually also theoretical insights and various schools of thoughts on paid and unpaid work that you have shown is very important. Even the feminist discourses you have included. I have also shared in the chat box study by IWage on in the chat box, and also Amrita Pritham, when Towards Equality report was presented in the parliament. At that time, it showed only 11% workers as main workers. And then the whole question of unpaid family work, the probing started, NSS changed its data collection method. So I think that history is important. And also you can also take a cognizance of some of the very important movements which took place on wages for housework during the 70s. We may not agree with the wages for housework as a demand, but it's a notionally that idea itself, recognition and reward for women's work, and also inclusion of unpaid work in the systems of national account. That debate also has taken place in the past. In the experience of Iceland, which is the only country which is where you had 100% successful strike. It connects with your last quotation, which you have given, that revolution began from kitchen, where all right from president's wife to each and every woman of Iceland had just struck work. They all took their sleeping bag and came out, and they were just living on the street. Even children they had left at home. And within a short time, the whole country responded, politicians responded that yes, we acknowledge it's a valuable work, but at the same time, sharing of housework, that also is very important. And you have also talked about the support services with the state and the civil society organizations, trade unions, also, they all have to provide to make a situation where women's degrees translate into career, and also each and every woman gets. Another issue which I wanted to flag was unequal wages. That is the most convincing argument at a household level. In any case, you are not going to get enough, no? Your salary is just a pocket money. Your salary is not going to run the house. When I am earning more, you just look after, do the care work and domestic work, while man would he's the breadwinner, roti kamane wala. So I think that unpacking of roti kamane wala, and that has happened more so very, very what you call normalized in the post-pandemic period. It was in the post-pandemic period where the NREGA officials started telling, what are you doing standing and competing with the man? Earlier, NREGA, only women were interested, and especially single women were interested, who did not. But during the pandemic, where men also were standing in the queue for NREGA, the official attitude was that they go and sit and look after the people. Oh, don't compete with the man. When so many men are unemployed, why should women be working? No, men are the breadwinner. They have the first entitlement to take the job. So I think some of these are arguments which a contemporary world is trying to address and try. This is a challenge also because nearly 24% of women who were earlier working in a pre-pandemic period are now out of workforce, not only in India, globally also. Even ILO has recognized. So I think this connecting the your study with this kind of important realities which are faced in the 21st century, and especially in the post-pandemic period, if you can connect, it will become a really very good knowledge, new knowledge, and also it will be very useful for the policymakers. Thank you.
Thank you so much, ma'am, for your remarks. Now I would like to request Tuba to kindly share the video recorded presentation of
Yeah.
Taji and Shreya ji.
Whose video is this?
Ma'am, this is of Tanisha ji's.
Tanisha ji. She was there, no?
Yeah, ma'am, she was there, but she had some other work.
Okay. Isn't it moving?
Tuba, have you like started it?
You just start moving the slides at least. Yeah.
Nice. Any opportunity, work opportunity that
You
that
must
includes traveling,
start
or
from
projects that
start.
require extended working hours to fulfill family obligations.
Keep yourself unmuted and start from the start beginning. Also keep yourself unmuted, then audio will come.
For my creative project and presentation, I wanted to give out. Some person who likes the stone, get its ready, supports the efforts and give medicines to cities. Yes, it's good. This is the care economy, the work that gives strength to life itself. So, my creative project is about gender burdens and social inequalities in unpaid care economy through the lens of class and class, where I have arranged various case studies to bring out the impact of class stratification on caregivers of different classes. My first case study is about a caregiver from upper class. She is a senior marketing executive at a multinational company living with her husband and two children. She employs a full-time domestic worker for housekeeping and Nancy for children. She most of the times denies any opportunity, work opportunity that includes traveling or projects that require extended working hours to fulfill family obligations. Along with this, due to her cultural expectations, she as women are seen primary caregivers, that leads her to feel guilty. She faces fatigue, self occasional anxieties. Moving to the next case, that is of a mid caregiver from a middle class. She's a school teacher, 38 years old. She earns a decent income, lives with and two children and her mother-in-law. Man of her children, she also manages doctor's appointment for her children and mother. Her husband contributes occasionally, but as in Indian societies, women are primary caregivers and men are considered secondary caregivers. She has not enough support from her family and husband. She cannot afford full-time domestic helper, and she has limited access to public healthcare centers for elderly care. She faces invincible emotional and physical labor that leads her to feel exhausted, socially and stagnation in career. These both examples from upper class and middle class caregiver shows that better shield women from unpaid care burden is just changes its form. My next case study is from a middle class in an old garment factory in Bangalore. She lives in a room rented house with minimum wages. Must lead on the risk of her income and even her job loss. She suffers from anxiety,
used to escape meals and rest to keep up with the responsibilities. This example illustrates how lower middle class women often carries heaviest physical burden of unpaid care, with fewer options to redistribution and reduce. The cycle of low income, high unpaid labor, lack of institutional support trap these working women in a situation of decreasing or suffering mental health and physical health. My next and the final case study is very special because I have collected it through participatory data collection with all your permission. So this is a story of a woman who is from a small town of Uttar Pradesh. She is a teacher and she has a story of the struggle. She says that dual burden is the new conspiracy against women. She married at the age of 23 and joined a private school as Hindi teacher to support the family. She used to work for 8 hours in school, 3 hours for home tuition, 5 hours of home chores every day, along with she is teaching her 2 children, taking care of her in-laws. She is not even allowed to go out for more than 3 or 4 hours because old in-laws are alone at home. She lived in this whole cycle for 15 years. She is the only breadwinner in the family of 5. Her husband and father-in-law forced her to bring money, even when she denied to work due to her health and workload. Her husband and in-laws are not ready, don't want to work. They don't want to work. So they forced her to work her entire life. She was humiliated by everyone in the house because none of the men wants to earn. One day she decided to get divorced to get rid of the cycle of humiliation. But her in-laws questioned her character in the society, and she is forced to get back to her in-laws and accepted their condition of earning money. Currently, this lady is suffering from anxiety and insomnia. With no hopes in life, she's passing her days with me. This highlights that women, that dual burden of women, is a serious situation where women are not initially in some places, in some rural areas, women are not getting educated. They are not allowed to work, and at some places, women are forced to work. This shows very insensitive situation of the society. With the permission of the participant and the insurance to keeping her identity and data secret, I have shared this case study to some to the youth, to women, and some stakeholders, and try to get their viewpoint, to get insights into this. So, a student, Ambika, from the University, she says, listening this case study, if this is the future of work-life balance, where all the burden is on women, then we don't want to get married. A dentist and public health expert, Dr. Abhishek. She says after a certain age, there is a need for proper rest for women. Living in physical and mental burden for many years lead to weakening of immune system. Mr. Mohit, a head of public medicine university, he says, when I get back to home after work, I don't like to contribute in care work at all. I understand the burden of my wife, but our work life and working conditions are so rigorous that it don't allow us to think to contribute to house chores. Mrs. Megha, an independent thinker, she says dual burden is a serious issue and I feel bad for these women who suffer. I don't want my daughter to suffer like this. If these scenarios continue, women will not be able to grow themselves. And as parents, we will also suffer emotionally to see our daughters in physical and mental suffering. So, at the end, I just want to say this is the high time to bring national policy on care economy in India. And I hope that my research paper will contribute in this regard, will be helpful in this regard. Also, there is need of an attitudinal shift in the society. Thank you.
Ma'am, you're muted.
Hello, yeah. Has she completed? Acha,
Yeah,
that's a
ma'am.
video, no? Yeah,
Yeah.
I think the video also talks about the unpaid care work and especially the double burden of women. And I think that is increasing a phenomena because among the working women, in fact, there was a film Meghe Takatara also, and the whole phenomena called hen that lays golden eggs. So the working woman treated as just only breadwinner, where the man in the family don't do anything, whether it's a brother, father, or husband. And it happens both in the natal house as well as the matrimonial house. And so many times it is also linked to the violence, no? Because they all develop the vested interest. So I think it's a very important dimension that she has brought in. But at the same time, I think we also need to connect it with the gender norms, that at one level, the gender norms believes in gender-based division of labor. And even when gender norms are broken, gender norms are given up, what kind of newer ways of exploitation that takes place in the family, even when you are working. And you face, because in the women's organization, women getting 5 or 6 digit salaries and husband not doing anything, or male members in the family not doing anything, not earning a penny, they also uh, exploit psychologically, emotionally, and also physically also, they attack them. So it is also a question of subordinate status of women. So that has to be, that connection has to be brought in. That yes, earning is a minimum necessary condition for a dignified life. But in the patriarchal setup, where women have a subordinate role within the family, subordination that also manifests in this type of exploitative behavior, where overworked women, because that's what this whole phenomena is called as a hand which laid golden eggs. So if your hand is giving golden eggs, then you would even cut it. Your greed would take you to such an extent that you would think that, okay, why don't I cut this hen and get from her stomach as many eggs as possible? No, but in the process, hen dies. And the same thing is happening to the modern day women, and more so in Western world than in our country. But it is happening in a big way. Yeah, but it's a good presentation, very powerful.
Thank you, ma'am.
Case
Now,
studies are very powerful. Yeah.
thank you, ma'am. We'll request Tuba to play.
And I
Share.
think with her also, I suggest that you share Kabhi Na Khatma Hota Kaam, that is also, and I have shared the document by IWage on women's work, paid and unpaid work, and Amrita Pritam's poem, which was written, it was a long poem, Amrita Pritam wrote in response to Towards Equality report when it was debated in the parliament in 1974. She wrote a very huge epic poem called From the Darkness of Womb to the Silence of Grave, which encapsulated each and every existential reality of an Indian woman, right from the time she's in the tummy of a mother, a pregnant woman, and till the childhood and adolescence and marriage and work, the contribution that she makes through paid and unpaid work. So I think that will also be useful if they want to use it as a reference. Yeah, man. Hello, Dubai is not moving. Fine, just show the PPT. I have been in touch with the fellow, and on email also I have had a lot of communication with her. Thank you for this very important and most neglected issue in the reproductive health of women. I think PCOS is one which has been trivialized, mocked at. I know, and especially in the IIT, I used to go as a visiting faculty for nearly 10 years to IIT, and how the men talk about the PMS women. Ma'am, she's a PMS, no? Premenstrual syndrome women. So it is a very trivialized and under-researched and not much public education is provided about PCOS. Another issue is that of a menopause. Again, a very much a neglected issue, both by the family, by the community, and by the education institution. So I congratulate the scholar for fellow for taking up this challenge. My only aspect is that she has narrated the problems, challenges, and the pain of PCOS students. But at the same time, you should also connect it to the whole male-dominated discourse. All the bodily changes in man, they have been research, scientific, this thing, legitimacy. Their experiences are legitimized, while that of a women are only seen as an excuse, no? That is a major double standard that we have. If a man faces any stress, then they will be seriously attended to. While a woman, they would say it is psychosomatic, she's imagining. No, so that very Freudian thinking, because Freud also always saw women's problem as that of a hallucination. No? So I think that needs to be that theoretical understanding by the feminist psychoanalysts such as Juliet Mitchell, feminism and psychoanalysis. I think that has to be brought in. So the theoretical grounding has to be given. Case studies are very powerful. Thank you.
Thank you so much, ma'am. So this was all the presentation, and I would have to say thank you so much, ma'am, for being so patient, listening to all the presentations. I know we have extended pretty much. It should have ended by 1:30, but it's almost 3. But that shows your dedication and passion to fellows' work. And with this, I would like to proceed to formal vote of thanks. As we conclude the day 10, which is the final day of Public Policy Qualitative Participatory Action Research Fieldwork Fellowship Cohort 6.0, I, Sana Ansari, on behalf of IMPRI Center for Human Dignity and Development, extend my heartfelt gratitude. We sincerely thank our chair and expert for today's section, Professor Vibhuti Patel, for her invaluable contribution and for engaging us in a powerful discussion. We are deeply grateful and thankful to all the experts and speakers who have engaged with us throughout this fellowship and enriched our understanding with the insightful discussion. A big thank you to all our participants for their presentation and engagement today. Your active participation and curiosity have enriched our discussion and make this meaningful learning experience. The session leading and resources will be shared via email. A video recording of today's session will be available for next 15 days. We look forward to staying connected and seeing you again in next cohort of future IMPRI event as well. If you're following our work by watching it on YouTube or listening via podcast or reading our publication, we truly appreciate your engagement and support. Once again, thank you very much for being part of this initiative. Wishing you a great day ahead and happy Diwali, everyone.
Yeah, thank you both the moderators, Mr. Shelar and Ms. Tana, for seeing us through. It's a 4.5-hour session, and most important, the background work with the IMPRI team has done, Dr. Arjun Kumar, Dr. Simi Mehta, Priyanka Negiji, and the whole IMPRI team. The kind of work and hand-holding they have done throughout to facilitate the whole process of research essay is very important, and we are equally thankful to all the resource persons who have made a dedicated effort to communicate and to share their knowledge and experiences. Thank you.
Thank you so much, ma'am.